o'clock. All right, welcome everyone to the Freeport Town Council meeting 02-22. Today is Tuesday, January 18th, 2022. Time is 6:30 p.m. and we will call the meeting to order. Please, before we do the pledge, let's do a roll call. See if everyone's here. Councilor Pillsbury.
Present.
Councilor Fournier.
Here.
Councilor Lawrence.
Here.
Councilor Daniele.
Here.
Councilor Bradley.
Here.
Councilor Egan.
Yes.
And Chair Pilch is here. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. Our next order of business is to waive the reading of the minutes of our previous meeting, number 01-22, held on January 4th, and to accept the minutes as printed.
So moved.
Second.
Would anyone like to discuss or make any changes to the minutes? Nope. All in favor of accepting them?
Aye.
Any opposed? That's unanimous. On to our third order of business, which are some announcements that I have to read. Join the town of Freeport from February 3rd to the 7th for a public design workshop for the Freeport Downtown Vision Plan. The project team will host an open studio in downtown and facilitate roundtable discussions and workshops to co-design the future of downtown Freeport together with the community. For more information and to register, visit freeportdowntown.me. The Appointments Committee is seeking residents interested in serving on some of the many town boards and committees. The committee will be meeting soon to discuss filling current vacancies and terms, which will be expiring at the end of March, including spots on the Appeals Board, Hunter Road Fields, Board of Assessment Review, Coastal Waters Commission, Library Board of Trustees, Planning Board, Winslow Park, and Project Review Board. For more information on town boards and committees, as well as applications, go to freeportmaine.com and see volunteer opportunities on the home page. Applications are also available at Town Hall. And lastly, the Aarp Foundation Tax Aid program has not fully launched for the new tax season. If you visit the website below near the end of January, you should find the site locator tool where you enter a zip code and find locations nearest you for in-person tax preparation with limited personal contact due to COVID-19. If you visit the page now, you will find information on online tax preparation assistance and self-filing software that's available at no cost to qualifying taxpayers. And I'll read the URL for those interested. It is aarp.org/money/taxes/AARP_tax aid with an E. Our fourth order of business. Oh, sorry. Any other announcements? Councilor Egan.
Coming up this Thursday at 7 o'clock virtually on the town's Zoom account will be a workshop and seminar, Freeport Climate Action Now. It's an educational and informational session for people in our community to learn more about what they might be able to do to address upcoming changes in our climate and to better understand what's causing those. And also to just learn more about the people and groups in our community that are working towards this issue. That is 7 o'clock on Thursday. It's all online. It will be originating here at Town Hall and broadcast on the town's Zoom account. There's a large banner across the post down at the south end of town where Desert Road comes into Route 1. If you have information, there's some details there, or just go to the town website. You'll be able to find information about it. Thursday, 7 o'clock.
Any other announcements? Our next order of business is information exchange, when councilors are welcome to update us on any goings-on or significant events that you've been a part of or been interested in? Does anyone have anything to share? Councillor Lawrence.
I do. I went to the Complete Streets meeting on last Tuesday, and they are figuring out how to get us a path from downtown to the YMCA and the Royal River Bridge, and they've come a long way in figuring it out, thanks to LL Bean and the group that is doing the solar farm. So they were very excited about it. And there's other things going on, but I forgot my notes today. But that was the big thing. So
I am excited about that trail as well, for sure. Anybody else? Councillor Bradley.
Yes, I'm reporting on the Island Rover. I received from Twain Braden, a lawyer for Harold Arndt, a launch plan, which was in a fair amount of detail. And I sat down this week with the town manager and Adam Bliss, and we went through it in detail, made some decisions among ourselves about what we need to do in terms of due diligence before we bring it to the council. And we'll be doing that over the next couple of weeks, hopefully, and hope to have a package for you, for your consideration, next meeting or the one after, depending on how that work goes.
I think a lot of people will be very happy if that boat gets to launch soon. Any other information exchange items?
no, just how the cleanup go? Is that still in
Yeah,
progress?
Again, I'm just one set of eyes, but I think between what Earl did with the town and what Harold did on his own and what Carter did, there was a substantial cleanup of the right-of-way and the site. If you went out there, you would say a lot of work has been done and it's a lot better. The plan is for Harold between now and, the summer to sell the things, or try to sell the things he thinks has value, and then to have one last round of cleanup at the end. So I'm pleased that there's cooperation and collaboration, and it's leading towards, I think productive collaborative discussion about the launch plan itself. So at least in concept, it's working, all hands on deck, so to speak.
That's great. Well, thanks for your work on that. It's excellent.
All right. As is custom for the last several months, we've got an update from the Downtown Vision Plan, which I'll invite Mary to give. Our consultants have been busy preparing for our design week, which is February 3rd to the 7th. The website now is being updated almost daily, so it's a very busy time for the group, dealing with a lot of logistics for the design week, which is actually more of a design weekend as it goes from a Thursday to a Monday. So if Mary is ready, I'll let her give an update to the council on what's been going on. We can see Mary, but we can't hear Mary.
You can't hear me? I am unmuted. Caroline, do you need to?
No. Seem to be.
Can you hear me? Oh my.
No.
No?
Oh, do we need to join audio?
No.
Is that us?
Hold on.
Hang on.
This computer,
There we go.
this computer was not hooked up to audio.
All
I'm
right.
trying to amplify off this computer.
Try again, Mary.
Yep.
How are we doing? Can you hear me?
Yes, we can hear you. Congratulations. Okay, take it away.
Alright. So here we are, 2 weeks from now, 2 weeks from this weekend, rain or shine, snow or muck, we are doing our downtown design weekend. And as you have seen before, the weekend is really divided into several different meetings. And the whole plan is, this is now going from phase 1, where we talked about what we wanted, to phase 2 and 3, where now we design what we can do so that in phase 3 we have a plan that comes out of that back end. So during this design week, there are 2 meetings, the kickoff and the closing, that will be at the high school. And these are public meetings. There will be forums that will be describing exactly what we're doing for the week and exactly what's come out of the week. Then in the center of that week are 7 workshops, and these are workshops that are based upon what we as a community said were more important topics to us, that will be diving down into what we can do based upon what we said we wanted. There'll also be open studio time when the community can come in and take a look at some of the designs and sketches and things that are being done. So again, a great weekend that's in front of us. Please, how do you get involved? As Dan said, go to the website where you can sign up for either the workshops themselves or for the newsletters that are coming out. Because one of the big things we've been doing over the last couple of weeks is all about communication. We're sending newsletters out on a weekly basis that give you more details into the content behind each one of these workshops. So it tells you more about what the background is, what the questions are, what to think about before you get to the workshop. And we put posters up on Facebook, on Freeport Friends, in community locations, so that we're trying to get as many people signed up for this Downtown Design Week as possible to get the community involvement. So now, Caroline, can you put up the other slide that shows who has signed up for what? One moment, please. So, and as all of us know, and you're going to be talking about it in a bit, COVID is always playing into how we're doing this planning. And I think at some point we may be an interesting case study of how to do a complete downtown planning during the entire period during COVID. So as you can see, we've had tremendous response from our community for attendance at these meetings. You'll see at both the kickoff and at the closing, we're at 96 people at the kickoff. So because of this, one of the changes that we have adopted is that both the workshop, the kickoff, and the closing, those will be live in person with masks in the high school. And then the actual topic workshops themselves will be remote. We made the choice this week to make planning for those remote needs just because the numbers of people who wanted to attend were increasing, and we wanted to make sure that everyone was safe. So more to come on that. You'll hear much more about that. But again, our idea is that we want people involved. And so with technology and other things, we're working to make sure that we can include everyone where they can so that we get the community's insights on where we go from here. So great attendance. Thank you, community, for all of the passion and participation in this. We're really looking forward to it. Dan, anything else I missed?
Thank you, Mary, and thank you, Caroline, and everybody else on the project team. This has been an interesting exercise in planning as our plans have changed literally week to week. We changed the date, we changed the format, we changed the location, all in response to COVID mostly. Each of us counselors has a schedule, the same schedule that was up on the screen. I think there's some on the back table as well. Feel free to distribute. If anyone needs a copy of the schedule, let me know. Happy to share. To clarify, there's a kickoff workshop Thursday evening and a closing workshop Monday evening. Those are both in person at the high school. There is also a live streaming of both those. So if you don't want to attend, you can watch those on TV. The blue sessions, the topic sessions, those are remote only. So you have to zoom into those if you want to participate in those. And then the purple areas on Sundays, open office hours, you make an appointment and you come in to talk to the folks. I would like to extend an invitation to any counselor that wants to talk one-on-one with me, with Mary, with the project team, to make sure that you're getting the information that you guys would like to have prior to the design week, at the design week. Anytime, just let me know. Mary and I are both happy to meet with you. We did put on the calendar 2 additional council workshops dedicated to the downtown design vision. Those are Tuesday, March 29th and Tuesday, April 12th. And we'll have those in the formal calendar at the next meeting, but I want to give you a heads up. And that was in response to our last meeting when we tried to anticipate how many workshops we would want to have. But after the design week is done and the plan starts to solidify, we'll have an opportunity to kind of workshop it here at the council on those 2 Tuesdays, and we can do more if we need to. That's all I got on downtown design. Any questions?
Thanks, Mary.
Thank you all.
Thank you, Mary. We're ready for our next guest. We've got Zooming in by request from Midcoast Hospital, our Lois Skillings and Dr. Chris Bowe, who have asked to speak to us tonight about what's going on at the hospital and kind of give us an update on the conditions there. So if they're ready, now would be a great time.
Great, thank you very much. And it's good to see all of you here tonight, and thanks for inviting us back. I think it was about a year or so ago, or anyway, that we were here to talk to you about our vaccine efforts. And you all have seen the results of that over the course of the last year. And we wanted to just share with you what's happening now, because as we're seeing this, especially this latest surge that really started in earnest in late November, and it's just really ramping up now. We thought it would be important to get a pulse check from your local healthcare system. And again, Dr. Bovee is our Chief Medical Officer. I am a Freeport Falcon, Lois from Pownell, and so it's always great for me to come to Freeport. And I'd like to share with you a PowerPoint that we put together. Would that be okay? Or I did email it to you. I don't know if you'd like to share it yourself, or would you like me to drive?
Peter, is it easy?
Nope. Louis, why don't you go ahead? We'll make sure you've got screen sharing abilities there. Caroline's got it, so.
Okay. Are you able to see it?
Yes, we are. Go ahead.
Okay, great. I'll just start from the beginning here. Midcoast Hospital here, we have remained at really full capacity for more than a month, actually since before, just around Thanksgiving. And, you know, early on in late November, we really started to see the ramp up of inpatients here, not just at Midcoast, but throughout the main health system. And the last few weeks of December, we started to see a slight decline in the numbers of patients. And as of today, we're caring for 12 inpatients at Midcoast. And in December, late December, it was 25 a day. But we're seeing a huge amount of community increase. And our emergency department, every single day is overflowing. We have a 21-bed emergency department. There are days that we have over 40 patients at once. We have now hallway stretchers that we put patients in the emergency department for this overflow. Every one of our med-surg beds has been full. We have 54 medical surgical beds at Midcoast, and our intensive care unit has also been full. So it's really been the most challenging that we've seen here since the beginning of the pandemic. What we prepared for back in March of 2020 and we were thinking would happen then is actually happening now. And it's created this need for us to actually pause. Beginning in November, we paused for patients who did not have emergency surgery, but it was more elective, like joint replacement surgery that may need to spend the night. We've had to put a pause on those procedures. And then beginning 2 weeks ago, we actually dialed back our freestanding ambulatory surgery center so that we could transfer that staff to help us to care for the inpatients and the emergency department patients. And also transferred some of our primary care providers, some of our internist and also a nurse practitioner to help us in our intensive care unit and on our medical surgical unit. So this need to redirect some staff because of staffing shortages, because of this surge that we're seeing, especially with the highly contagious Omicron variant that has been really prevalent here in Maine since late December. So this peak that you see here on this graph, this shows you the data of all of Maine Health, all of the state of Maine statewide and New Hampshire statewide, and then also at Maine Health, seeing this peak that has been just really happening since the mid to late thing. I keep saying the word Thanksgiving, but November, you know what I mean. So ways that you can help. I mean, this is why we're coming here tonight, to really appeal to the public, to let you know that your healthcare system is as challenged as it's ever been. And people are working so hard. and to ask you all to please wear a mask regardless of your vaccination status. The good news with Omicron is that we're seeing that the disease is mild with people who are healthy and are vaccinated and have boosters. We're seeing that it's a mild case. And so that's the good news. The bad news is that it's spreading like wildfire. So get vaccinated, and as soon as you're able, get your booster shot. And I have at the end, we have some examples of where you can get your booster shot easily. And the vast majority of those that are hospitalized for COVID-19, those that are on respirators, and those who are dying of COVID-19 are unvaccinated. And also to ask you to please be kind and patient with your care team members. People are working extraordinarily hard every single day in the face of significant capacity and staffing challenges. It's really unlike anything I've ever seen in my career with the number of patients that we're seeing, and also the challenge now that we have with staffing shortages. And also to ask you to get your flu shot. We are also seeing influenza in Maine, and it's really helpful when people get their flu shot to decrease the number of patients that we're seeing in the hospital. So I'd like to turn this over to Dr. Bovey, who's our Chief Medical Officer, to talk to you a little bit more about some of the details around some of this. And so over to you, Dr. Bovey.
Great. Good evening, everyone. It's my pleasure to be here with Lois and to have a chance to speak with this group. And of course, we'll be happy to answer any questions and engage in any dialogue. But when it's asking of what people can do to help prevent this spread, masking is one of the things that has been proven to limit the spread of the coronavirus. So it's a significant addition to help protect people, both protecting yourself and protecting others. And when combined with vaccinations and boosters, and then efforts to maintain your physical distance from those outside of your household, being careful with hand hygiene, as we've all been learning to do for the last 2 years, more so than ever before, and then avoiding those large gatherings and ensuring that you're in adequately ventilated spaces as much as possible are the basics. And the basics have been working. As much as people are able to, those really have a strong impact on preventing people from becoming infected. And we've been very fortunate to have evidence of that. So at Midcoast Hospital, transmission between patients and staff has been incredibly rare. In fact, the very few times that a staff member has been infected by a patient with the coronavirus, each time we were able to identify what was missed in our personal protective equipment. You know, if someone wore a surgical mask when they were taking care of a patient who was positive for COVID-19, when we would normally wear an N95 or should be wearing an N95 and having our gowns and our eye protection, we were always able to identify on any case where a staff member was infected. And really over the nearly 2 years of this pandemic, we've had less than 5 cases of a staff member being infected. So it really goes to show the value of those basics of washing our hands, keeping our distance as much as possible, making sure we're masking, and then when we're caring for COVID positive patients, using all the extra personal protective equipment or PPE that we talk about all the time. Wearing masks indoors in public spaces is a definite way to protect ourselves. And this next slide actually demonstrates some of the effectiveness of masks. This is a very fascinating slide to go through. So on the top bar, on the x-axis, you see if a person was going to be exposed to COVID-19 from someone else, whether they're wearing no mask, a cloth mask, a surgical mask, or an N95. And then on the y-axis on the left side, it's what the person who's infected with COVID is wearing and how long it takes to give an effective dose to an individual. And you see if neither person is wearing a mask, you'll have the ability to give a full dose, an effective dose of COVID in just 15 minutes. But even if you just follow along the top, if the person who's infected with COVID is standing next to someone who's wearing a fit-tested N95, in 2.5 hours, they only give a 10% dose of an effective dose. So there's dramatic protection by wearing a fit-tested N95, but even when you step that down to just a simple surgical mask, you double the amount of time and then half as much of a dose in those 30 minutes. So this just goes to reinforce the benefit of masking when we're around individuals who are not the individuals in our homes, to protect us so that we have added time to be in the grocery store or all those tasks we need to do in public and be safe around others who may be infected and perhaps don't yet know they're infected. So people can be contagious, of course, for approximately 48 hours before they have signs of infection. So, an individual may not know they're infected, and if we're careful around each other, we can prevent ourselves from that exposure. And if we could go on to the next slide. The one really, really important thing is vaccination. And so far, we've given over 73,000 doses of the vaccine and had just an amazing community response. We've been able to go to schools. We were in the Freeport schools and other schools in the area, as well as having it in Brunswick at our rec center and now on our campus. And we really, really encourage people to get vaccinated. And if you're eligible for a booster, to get that booster. And there's certainly a lot of sources of information online and a lot of different voices that will tell you different things. And when someone's uncertain or someone's hearing lots of different information and is confused about whether they should be vaccinated or not, we ask that they go to their trusted healthcare provider, the person who they've trusted for their health, and talk to them about whether they should get vaccinated. That has been a source where a lot of people, we've had a lot of patients come to see our providers, and we know other health systems as well, that when patients are confused and being bombarded with all kinds of different information, that the chance to talk to their healthcare provider, someone who they trust with their health, is a great way to get information and to understand, I believe, the value of vaccines. We continue to offer vaccinations on our campus. We have sign up for appointments. You can reserve your appointment and you come in and you get vaccinated very quickly. You have a 15-minute observation and you're out the door, and people can sign up at that address listed there of the vaccine.mainehealth.org. And we've also found that, of course, some people just are having a challenge signing up, and it's difficult at times. So we've established what we call our walk-in Wednesdays, and where individuals can come between 9 and noon and just come and get a vaccination. They don't have to sign up in advance. We want to make it as easy as possible for anyone interested in getting vaccinated to walk right in and just get a vaccine. So we have that on Wednesday mornings. We have the sign up for our other times. We also have a phone number that people can call and get help with making an appointment if that Wednesday morning doesn't work and they need someone to help. So we really encourage people to get vaccinated. We believe that helps us, that protects people. I'm a practicing emergency physician. When I'm seeing patients in the emergency department and they've been vaccinated, it's been very predictable that that they do not get as sick. Certainly people can have a lot of underlying illnesses and get infected even after being vaccinated, and it can make them sick, but it doesn't make them as sick as what we've seen with our patients who have not been vaccinated. So we really want to keep our patients as healthy as possible. So we encourage those vaccinations. I think that's our last slide. I know we're both very happy to answer any questions and have any sort of dialogue that anyone would like. So thank you very much for letting us present tonight.
We really appreciate it. And we recognize that really our message is that your healthcare system here at Midcoast throughout Maine Health is experiencing the biggest surge of COVID patients that we have since the beginning of this pandemic. Is putting a big strain on your health system, but also impacting the care that we want to be available to provide for patients who don't have COVID. So asking the public to do everything we can to help once again stop the spread and bend this curve, especially as we're going through this very highly contagious Omicron phase that we're in right now.
Thank
Any
you
questions
to
for us?
both of you for taking the time to come and give us the update, and thank you too to the staff and everybody there at the hospital for doing what you do. I know it's not an easy time for you as well as the patients, so thank you again for what you do. I think there are some questions that folks are likely to have, so I will start with Councillor Bradley, who looks like he has a question for you.
Yes, the question I have is, do you have any information about how many booster shots make sense and what the time period between them should be? If you've been boosted, is that the end of it, or should you be looking at another booster if you're concerned about being fully vaccinated?
That's such a great question. Thank you for asking. So right now, the boosters are available for anyone 6 months after if you received Pfizer. It's a little different on each vaccine that you received. If you received the Johnson & Johnson vaccine, you can get it after 2 months after that vaccine. If you received a course of Pfizer, it can be after 6 months, and Moderna's after 5 months. There is not a second booster dose timing recommended yet, but I would suggest we all hold on and wait, because I anticipate that there will be further boosters in the future. So right now, making sure you're vaccinated, and if eligible for a booster, get that first booster. There are some unique situations where people have a high degree of immunosuppression from a disease that they have or medications they've been given that may qualify for a fourth shot, and connecting with your physician or your provider can help you see if you're one of those people, and we can get you in and get you vaccinated. Thanks so much for asking that.
Councilor Fornier.
Thank you very much. The question I have is, I think we've done a good job of getting the messages out on properly washing our hands, wearing masks when you're around people and everything, and we've seen a lot of that. But I've also seen some negative aspects of some of the mandates that have concerned me with people leaving the healthcare profession and public safety, and I know you've experienced some of that in your organization. So if we have a strong positive message, I hope that we could accomplish this without having a lot of backlash from people who want to just push the system. When we say we got to do something, there's people out there that are going to be obstinate and not do it. It'd be nice if we could find a middle ground to get everyone wearing a mask and anything. I hope we could accomplish that without, having required mandates.
I see your point. I really do. And I would like to just reinforce with you all, just to help to give some, counter messages, that the actual vaccine mandate in healthcare was a big help with the number of people. We may have lost a few, but here at Midcoast, it was just a little over 1% of our workforce. But actually the number of our workforce that were out of work because of COVID, and the length of time now because of the boosters and Omicron, is actually less than before the vaccine mandate in healthcare. So I think we're going to find that in healthcare, it's going to work out okay for us to have had that. But I totally understand the sentiments of the public. It's hard. Let's face it. Everybody's tired of this pandemic. I mean, honestly, some of you, I'm sure, are thinking, oh my God, I don't even want to hear this one more time. It's all we hear about on the news and I read and everything else. I think that's why we wanted to tell you tonight, we're just having this one more push here. It's really hard right now with Omicron. There are some good parts of what's happening now, though, because Dr. Bovee is, even though my background is as a nurse, he'll explain it, I think, even better about how we're seeing that this current variant is a little less virulent, meaning that it's not causing a severe disease, especially among vaccinated people. Yep. They tend to have fewer symptoms and it's tending to pass quickly. But there's still the matter of the vulnerable people among us, and right now the health system's overwhelmed. That's really the issue right now. Anyway, you want to add anything to that, Dr. Bovee?
Yeah, no, thank you, Lois, for mentioning that. I think the health system, and in particular our staff, are overwhelmed.
No question.
And as Lois described earlier, our emergency department, if you need to come to our emergency department, I have such confidence in our team. Our team is wonderful. They will provide excellent care for you. But there's a chance you'll be in a stretcher in the hallway. And we don't want to treat you in a stretcher in the hallway. We want to treat you in a room. But we need to see you somewhere so that we can take care of you. And our teams are going above and beyond. People are working extra shifts because their partners, their colleagues are out sick with COVID. Our staff has just been incredible. We're so grateful for what they've done. And at the same time, the public is at times less patient because they expect, of course, to get great care and be seen really quickly. And they're surprised when there's anything holding them back from being seen or visiting someone. And we feel bad about limiting visitors. We feel bad. We've had situations where, a couple is expecting a baby and the mother's coming in for an ultrasound and the family wants to be there. Their significant other wants to be there for the ultrasound. And we just can't have them present right now because of the risk of the infection being so high, and so much of our staff being out from these exposures. So we do really request that the public has patience with our staff, because our staff is doing just such an incredible job. And then any steps, wearing that mask so that you don't infect somebody else and you don't get infected. And then when a family member or a neighbor has appendicitis, that they can just get in and get seen and get taken care of right away. That's where we want to be. That's where our teams want to be. They want to be right where we were before this began, which was focused on taking great care of patients the moment they came in, and not trying to figure out who can work today because who's infected, and how can we manage all those regular normal tasks that are so much harder in the time of COVID.
Just one more for question. Do you think the Maine CDC will be coming out with any mandates?
I don't know. Yeah.
Yeah, I don't either.
I
It's
don't.
kind of
Yeah.
interesting. Thank you. Thank you.
Yeah.
Councilor
And
Grant?
we're not asking you to have a mandate. We recognize that public policy is your expertise. Our expertise is healthcare, and we think everybody should be wearing a mask. I think that's the thing that, that we know about, is that we know that masking prevents the spread of this disease. Whether or not and how you require it within a municipality is something that it's complicated. But we support it. If you were to choose to do that, it's something that we would support.
Thank you, Laura.
I have a question for you. I know that if somebody shows up on your doorstep at the emergency department, you'll provide care. You won't turn them away on the street. Is COVID impacting your ability to deliver medical care in all the other parts of the hospital?
It is, as Lois mentioned earlier, a number of the regular things we do for routine important care for people, a screening colonoscopy to make sure you don't have colon cancer. It's harder to schedule those. We've had to take some of that staff and ask them to come over and provide care in different areas because we've had staff infected with COVID unable to work. We've had to limit some of the regular care that we normally would do. And then our processes take longer just to make sure that we're keeping everyone safe. So again, that example of someone comes in with appendicitis, we'll check to make sure they don't have COVID, and we'll wait for a COVID test before they would go to the operating room, and so that all the staff know that this person doesn't have COVID when they take them to the operating room to remove their appendix. So it adds time and it makes it a little more challenging, but it's necessary to keep our staff and all of our patients safe. It's so important to us that we don't have someone come to our hospital and get COVID at the hospital. That is something so very important to us. So we have a lot of safety measures in place, but they take added time. They really do.
So I would say for urgent or emergent care, there really is not a difference because that's what we're here for. But for that routine care, like I said, since Thanksgiving, we have not been able to do joint replacement surgery for people who might have to spend the night because we haven't had a bed. So that's been postponed. And so right now with some of our primary care staff helping out in the hospital, it may take longer to get a physical schedule than it would normally. But we're still doing those physicals. We're still seeing people in our primary care offices. During March of 2020 and April and May, we actually shut down all of those services. And that's not happening now because we saw a real rebound in people who, you need your preventative care, you need mammograms, you need your screening colonoscopy, you need to see your primary care provider. And so we're doing everything we can to keep that access to healthcare as open and available as we can. Although, as Dr. Bovee said, sometimes it may take a little bit longer for the things that are not urgent or emergent.
Thank you. That's helpful. Is the level of care that you're seeing, level of patients, the capacity of the hospital, is this something that reminds you of another time when things were busy, or is this really an extraordinary, once in a lifetime, you've never seen this kind of capacity issue before?
I've been a nurse for 42 years, and I have never seen it like this. I have been here at Midcoast, between Midcoast and Maine Medical Center my whole career. I've never seen it like this. I've never seen, I don't want to be sensational here. I've never seen the amount of deaths that we've seen from COVID patients here in a community hospital or even just in our country, in our state. It's overwhelming. And when you're an intensive care unit nurse or doctor or respiratory therapist who day after day, week after week is seeing this kind of disease burden, this is going to impact an entire generation of healthcare providers with the amount of disease and death, frankly, death that we've seen. Right now, there are numbers on a TV screen every night when you see the numbers of people who are dying in Maine, the number of people who have died across our country and across the world. But to our staff here that every day are living this, these are real people that don't have their family here close by them, that they're working hard to get Zoom ability for getting across a Zoom meeting or FaceTime to get a chance to see their loved one. And of course, we bring loved ones in when it's near the end of life, but it's really, I'm glad you asked that because I can tell you honestly, I've never seen anything like what we've been seeing.
Thank you. I appreciate that. Any other questions, comments from counselors? No? Okay. Thank you again, Ms. Gillings, Dr. Bowie. I appreciate you taking the time. It sounds like you've got a very, very, very busy schedule and are doing very important things, and I appreciate you taking the time to come talk to us, as I know you have with other towns. So thank you again.
Well, thank you. And we are very hopeful that soon we'll be turning from pandemic into endemic and learning how to live with this, live with COVID and get to a better place. So thanks for your attention tonight and for all you're doing.
Thank you.
Thanks. Okay. If there are no other items of information exchanged from counselors, then we'll move on to our town manager's report.
Well, I'm glad to cede most of the time that I've had to some of our experts that we have up on the screen that we just had in. I've only got one item. Everything that we've been working on for the past 2 weeks, which is quite a bit, is in front of you on the table tonight, so I'll just save my comments until we get there. It's been a little bit crazy. I do want to just comment about this weekend. I want to send a thank you to our public safety staff, police, fire, and also our public works staff. Specifically, a lot of people don't know, but behind the scenes, we do work up a little bit coming into a predicted high wind event. We had one last Friday, and we had one just yesterday that didn't, and neither of them really materialized, but there were some pretty scary numbers that were going out, 60 plus mile an hour gusts on the coast. So we didn't see anywhere near that in Freeport, but just thanks to both of our chiefs. I know we got Paul in the background, but also our public works crew who were in plowing all day yesterday. Thankfully, we were fine, but just want to give them a little acknowledgement for the behind-the-scenes work on Friday over the phone and yesterday, and knock on wood that, you know, we're good for now. Of course, those events can pop up any week, and we'll stick around when they happen. So that's all I got, Mr. Chair.
Thank you. Thank you to the Public Works Department as well as the other folks in town who prepare for these kinds of things and keep us going. Okay. Our sixth order of business tonight, as it is with every meeting that we have, is a public comment period. This is a time for the public to comment on items that are not already scheduled on our agenda. So tonight, what that means, among other things, is if you're here to talk about masks, then hold off, because we will take public comment when we get to that item on our agenda, which is coming up pretty soon. But if anyone has anything that they'd like to address the council about that's not related to something on the agenda, this is a good time. And I do ask that, because I think we've got a lot of public comment tonight, that if you do have comments, please keep them to 3 minutes or less. And we'll ask the same of anyone who comes up to offer public comment. We've got a timer up there on the wall to help you kind of guide yourself. So with that, is there anyone who would like to come up to the podium and share any public comments? Yes, sir.
Nothing to do with masking, but
All right.
this,
Now's your
very
time.
small compared to this.
All
My
right.
name's Mike Yates, Freeport resident. I'm here representing my daughter and son-in-law and their business. The recent activities we had with the codes enforcement officer were nonetheless not a pleasant experience. And I don't do this lightly. I've lived here 48 years, and this is the first time I've come to council. We experienced some things that shouldn't, in my opinion, have happened. Come from a construction family, didn't follow it, too much work. I was ready to be a manager. That being said, it was a bad experience. Freeport, I've grown here. It's been busy. We're trying to grow again. And in my feelings, not saying the individual doesn't know what he's doing, but he needs to go to school to deal with his customers, which are us, the taxpayers, as well as people that want to invest our money in the town of Freeport. My daughter was adamant about staying in Freeport. This daycare nursery has been here for 20 years. We had to move out of a facility that folks wanted to use for an apprenticeship. We moved into another facility and invested a lot of money into it. We asked this gentleman to come down, go through with us. 2 or 3 times he didn't have time. It was just an awful experience. And I just wanted to bring it up to you folks. As a manager, if I had treated my customers that way, I wouldn't have had a job. It's just that simple. There's a little, my son-in-law, unfortunately, is out to sea, won't be in for a while. He wanted to get this, so you folks see early in the year, if there's any changes that could be made. Maybe, maybe not, but at least to expose you to what you guys wouldn't know. You know, if you don't have this type of thing to have to go through, you wouldn't experience it. So he's written up a little thing, he emailed it to me. I'll give it to you folks, you can look it over. Other than that, that's about it. But just to inform you, sometimes when you think everything's going smooth here in this facility, it's not so good outside on the town. And I don't want anybody else coming in here to invest a lot of money into the town to go through this. It's unnecessary, very unprofessional. And that's about it. I'll give you folks a handout, you can read it.
Can I ask a question?
Yeah, Counselor Bradley, I think, has a question for you, if you want to go.
I'm sorry, I didn't get you, you were coming up, I didn't get the name. I can't see your face.
Yates.
Mike
I
Yates.
know you did.
I know you too, Mike. I'm sorry, I just couldn't see you through the mask. Is everything that you're concerned about in this?
Most of it is, there was some other individual, who's no longer, is a former fire chief we've had here, was also a very bad actor. Unfortunately, I'll leave that alone, he's no longer here.
But your concerns about what happened to you in the code enforcement process are all listed in there?
Most of it's in there, that's for my son-in-law. He did the best he could being able to see. But he did want this to be shared with you folks early in the year rather than wait. The school's doing very well. Majority of our folks are in Freeport, so she wanted to stay in Freeport to serve the people. We had a chance to go to Yarmouth, but she was adamant. I just wanted you folks to know.
I just
Thank
want,
you for your time.
Thank you.
Mike,
Appreciate you guys.
Mike, I just want to be sure that the specifics of your concerns are known and that, you know, that you don't make a general complaint and we don't know exactly the details of it, but it's all in here.
It's all in here.
Okay.
I mean, you take it for what it is, and, you know, it was a very bad experience.
Okay.
These young kids who want to invest a lot of money in this town, and it wasn't right, it's not right. And sometimes you gotta bring that up so you folks know. Like I said, I've been here 47 years, I've seen a lot of changes in Freeport, awesome changes. We're doing great. We could do better. But we gotta have the backing here. We had folks from the state of Maine come down, we had,
Would you mind standing behind the podium just so we can capture what you're saying? 'Cause-
Yep.
so
We had
Counselor-
folks from the state of Maine, I know I'm out of time, come down, State Fire Marshal, Melissa, the head of the licensing division for these, and they have hundreds of places in the state of Maine. But they kept calling Melissa, anything we can do for you, please call us. We got no response from this gentleman. Our own town person. Not right. You know, he's probably a great guy, maybe he knows everything, I don't know. But I'm just saying, it wasn't a good experience. Things should change for people coming in. That was our experience. Thanks for your time.
Thank you for sharing, I appreciate it.
Take care, folks. Paul? Take care.
Any other public comment for tonight? Seeing none, we'll move on to our seventh order of business, which is the meaty part of our agenda, to take action on the following items of business, as read by your council chairperson. Our first item deals with our consent agenda. It's item number 18-22, which reads, be it ordered that the January 18th, 2022 consent agenda be adopted.
Second.
Thank you. On the consent agenda, the one that was printed and is on the website, includes 2 resignations, 3 victualler licenses, some awards from a trust fund, and some donations to the Freeport Community Library. In addition to that, the Appointments Committee met just before the council meeting and has some nominations that they'd like to add to the consent agenda. I think you all have a copy of this in front of you, but I'll read it just for the folks at home. It says, be it ordered that the following appointments to boards and committees be approved. Appeals Board, one appointment is from now through September of 2023 for Linda Hines. One appointment to the Library Board, starting now and going through March 31st of 2025. I apologize if I'm not pronouncing this right, but it's Katie Madger. Sustainability Board, one appointment from now through September 30th, 2023 for Leslie Graham. And then 2 student appointments to our Police Advisory Committee. One from now through September 30th, 2022 for Conrad Anderson. And one from now through September 30th, 2023 for Savannah Tracy. And lastly, one appointment to the Project Review Board from now through March 31st of 2024 for Lynn Hamlin. So with that on the consent agenda as well, are there any items on here that you would like to discuss individually and not as part of a consent agenda?
Hi, Chris
Wolf.
Wolf, Town Clerk. I just wanted you to know the reason there was a vitrular, in front of your place setting was it was a late arrival today. So that's why DeRosa's Restaurant's vitrular was at your place setting. It was already on the agenda. It's just, it got here late.
Got it. So it's already on the agenda. It's one of the 3 victulars licensed. We just have the paperwork for it that was added tonight. Got it. Okay. Seeing no objections, can I call for a vote on adopting the consent agenda? All in favor?
Aye.
Any opposed? Are you opposing or you have a question?
Well, I have I'd like to abstain from the vote on the student to the police, because one of them comes from a family I'm very familiar with.
Got it. All right. So
For everybody, and I'm actually for everybody, but I just want to abstain from that one vote.
okay, I think that means you're going to abstain from the whole consent agenda the way I think
Okay,
it's
well,
structured.
that makes it easy.
So that would make it 6-0 with 1 abstention for the consent agenda, which passes. Which moves us on to item 19-22, which is about, this is about having the public hearing that we set last time regarding our outdoor events ordinance, chapter 10. Which I believe, I don't know if Caroline wants to give us an update or I can just do my best, which I think is just updating the language in this ordinance to make it the same or similar to the language that we had updated at our last meeting. This particular ordinance wasn't one of the ones that we updated last time, so this is mostly about ADA parking and similar accessibility requirements for outdoor events with people, with more than 250 people. So it's updating that. So with that, Councillor Pillsbury, would you offer to open the public hearing?
I make a motion to open the public hearing on item 19-22.
Second.
All in favor?
Aye.
It's unanimous. So does anyone have any public comment about this particular item, about Chapter 10 updates? Caroline, is there anything that I forgot, or you want to clarify?
You did a really good job summarizing. It's just, this would apply to the events when they expect 250 people or greater and match the language you previously adopted for the temporary activities, which are smaller events.
Thanks. I'm getting good at this. All right, any other public comment? Seeing none. Councilor Pillsbury, would you like to close the public hearing?
I make a motion to close the public hearing.
Second.
All in favor?
Aye.
Any opposed? It's unanimous again. And Councilor Pillsbury, only read the be it ordained.
Be it ordained that proposed amendments to Chapter 10 ordinance require notice for outdoor events with attendance in excess of 250 people to add a standard about maintaining accessible under the Americans with Disabilities Act parking and access be approved.
Second.
All right, any discussion around that? Seeing none, I'll call for a vote. All in favor of item 19-22?
Aye.
Any opposed? That passes unanimously. Brings us to item 20-22, which is about enacting an emergency ordinance for a face covering mandate. And before we get into the be it ordained, let me set some context. We have a policy regarding town employees and vaccination and testing. That's not on our agenda for tonight. We have a policy for mandating that people in municipal buildings, like town hall and the library, must wear masks. That's not what we're talking about tonight. What's on the table before us tonight is an ordinance that would require people to wear masks when they're in buildings that are open to the public. So stores, restaurants, things like that. within the town of Freeport. I'm sure there are comments and questions about this one. But to get it on the table first for discussion, I'll ask anyone who wants to offer up to read the be it ordained. Any volunteer to do that?
Sure.
Councilor Daniele.
Be it ordained that Chapter 61 Emergency Ordinance Fates Covering Mandate to be effective January 18th, 2022 until February 18th, 2022 pursuant to the Freeport Town Charter, Section 2.14 Emergency Ordinance be enacted.
Is there a second for that?
Second.
Thank you, Councilor Bradley. So what I'll do is I'll open this up to public comment. It's not an official public hearing, but I think there are a number of people in the public who would like to comment. So I'd like to invite anyone up to the podium first who's here in the room to take up to 3 minutes, if you would, and let us know your thoughts. And then I think we also have some people on Zoom who may want to weigh in after we hear from the people in the room. So if you don't mind introducing yourself and sharing your comments.
Yep, I'm June Chambers. I am co-owner of the Sunrise Cafe. I'm here, I'd like to speak for myself, for the cafe, and for my employees. I think we've done a really good job at our cafe in keeping people, I hate to say the word managed, but I guess managed. We've stopped people from visiting from table to table. We're diligent with our sanitizing. We don't seat our parties until everyone is there. My staff has worked very hard. So, you know, we talked about the mask mandate that was going to come up tonight. And my employees are very, the anxiety level is high for them. And to think that they've got to wear a mask for 9 hours only makes that anxiety level higher for them. You know, my people need to work. We're shorthanded. We've been shorthanded for a year. So I do worry about losing the dedicated employees that I do have, because I'm not sure that along with all the things that they're doing now, and then they're going to have to police people to wear a mask. And people have proven in the past, when we had a mask before, that we had to wear it when it was a state mandate. The people were very hard to manage. It was very difficult for them. So I just, you know, I would wallpaper my walls with paper that says, you know, a mask is recommended. I think we should have a chance first to do that to see if that's going to work before we say, yeah, we have to do this. And just let us keep doing what we're doing. We've not had a problem with any COVID outbreaks at the cafe. Like, again, I'll say we've worked really, really hard to keep people safe and healthy at the cafe. And thank you for listening to me.
Thank you for your comments. Anyone else have comments to share?
Hello, good evening. Thanks for hearing my comments. Dominic Petrillo, local business owner. I guess I'll just start off by saying that I think it's a bad idea for the town of Freeport to adopt this emergency measure. I don't think that a town-enforced mask mandate is a good idea, and I'll explain why. First of all, just going through this mandate, there's a lot of things that I have an issue with in here. Public buildings definition. It looks like if you're in the back space, the office space, the mask mandate does not apply, according to this. The exceptions are pretty open-ended. Doesn't clearly define what an exception is. Anybody can just make up anything, and any exception that I decided was applicable to me fits into this description. Posting requirement, it makes sense. Of course, we're going to have to post that there's a mask mandate. The effective period is probably a pretty good idea, the 30-day effective period. I'd like to see something in there that says that it can be changed at any time with the Freeport Town Council's consent. I don't see any reason why there has to be a 30-day spread in between the enactment of it and the end of it. That doesn't make any sense. I also see in here that there's a $500 per occurrence Civil violation, up to a $500 per occurrence. That probably needs to be more clearly defined. It's not very clear as to what an offense is, how many offenses can you have within the building in the same day. And now I get to the part now where I really have a problem with enacting this. I think it's nonsense to have business owners enforce this rule. If you as a town council want to make a mandate for people in the town, you can find some other way to enforce it instead of making business owners and their employees responsible for enforcing this mandate. It is total nonsense for you to assign that to people that work in a business. If you want to do it, you can pay for the extra police to go around and police, but you should not be expecting, the town should not be expecting people within businesses to enforce this mask mandate. And the potential of a $500 fine per occurrence of violation for that person in the business is ridiculous. As we go down a little bit further, there's something that I think is even worse that's in this mandate. And I think that if you think clearly about it, you'll see that it should not be in here and it should not be part of this mandate whatsoever. And that is that that the police will be, Freeport Town Police is also authorized to enforce this ordinance. So you mean to tell me that we're supposed to call the cops and have the cops come down and tell somebody to put a mask on if they walk into the building? It just doesn't make any sense. And I think that this should be tabled for today and at least looked at again pretty clearly. And some of those items in there that are not clearly defined should be defined. And it should be left to the individual at the business as well. There's no reason for us to have to put a mask mandate up there that everyone has to follow. We're all adults and we can make adult decisions for ourselves, walking in and out of businesses and having masks on. I would say that the vast majority of people that come into my restaurant have a mask on when they proceed to their seat. Some of the employees mask, some of them do not, but they're also, there again, they're adults. They can make that decision for themselves. And if somebody doesn't want to come into the business because there are some people that aren't masked at all times, then they don't have to come in. This is a private business. Just because people come in there publicly, I see that I'm out of time and I'll stop, but I just think it's foolishness to ask that everybody be required to wear a mask inside of a public setting as it is defined in this emergency mandate. So thank you so much for listening.
Thank you, Dom. I appreciate it. I don't want to respond to every single comment that we have, but I'll do that at the end. But I do want to clarify, just for other folks who may want to comment along similar lines, that we were careful to craft the ordinance so that the business owners and operators are not required to enforce the mandate. So you're required to put a poster in the window saying that masks are required in the business. You are not required to, you're not expected to be the people that are policing the mandate. So I'll leave it at that. There are a lot of nuances there.
That may be true, Dan, and with all due respect, so what is the expectation then? That somebody else calls the police, that somebody in the restaurant calls the police?
Like I don't want to get into individuals, but it's a good topic, I think, for us to discuss, because I think a lot of the counselors have questions along those lines, very similar that I think we do need to kind of talk through and address. So we'll definitely talk about that.
Well, thank you so much again.
Yeah, thank you, Don. Anybody else?
Happy anniversary, too.
Thank you.
Some happy news. Good evening.
Andrew Arsenault. I'd like to speak in opposition to this mask mandate. I had to go out on the road today and listen to the radio, and there was a great discussion on children wearing masks, and I'm sure this is going to pertain to schools because it's a public building. And they said young children learn especially well if they can see other people talk. And when you deny children the ability to see people's mouths and see them talk, or even a new immigrant, let's say, or a new citizen to the United States that's trying to learn the English language, when you can't see people talk, you can't understand how to pronounce the words. I sat right here like a lot of Freeport people did. We sat right in these rooms here and learned first and second grade. I was in class with Lois. She came down from Pownell. We all went to school together. And, you know, you have to learn how to do these things, and part of that is you can't do it wearing a mask. And, you know, I just think when we were kids, they told us not to pull a bag over our head because we'd, you know, run out of oxygen, and we're breathing our own air. We're breathing our own breath. And it's just not right. And it's a 50-50 shot whether these things do anything or not. Even doctors will tell you. You hear them all the time on the radio. Yeah, we wear them in the operating room. If it's an N95 and it's properly put on, that's one thing. It's really, you know, I'm sure it's a 50-50 shot. Lots of doctors say something different, but a lot of them say it's really just for comfort of the other person, or if it just so you don't spit or breathe on somebody when you're hanging right over them. But most of the time, I think it's virtue signaling. So I'm opposed, so please mark me down.
Thank you for your comments. Anyone else, please? Yeah.
I got a handout.
Okay. Yeah, you want to pass them? Maybe I'll pass them down and you can head over to the podium.
Yeah, that'd be great.
Save some time.
I guess I'm there. My name is Jim Hughes. I'm a professional engineer. I've lived in town for over 40 years now. I'm not exactly sure. I'm also a Navy vet. I'm a life member of ASHRAE, the American Society of Heating, Refrigerating, and Air Conditioning Engineers. Basically, I'm not a doctor, but I am a scientist. I'm an engineer. And I'd like to speak against this forced mandate on masks. The handout I gave you, well, as far as disclosure, let me also disclose that I sell air purification equipment. So anyways, I think I've watched the whole COVID thing for 2 years now very closely, and it's part of my business. I have to be up to date on it. One thing I'd recommend is follow the science. Most of the people saying follow the science don't follow the science. Let me tell you a little science about masks. On that handout, you see there's lines there showing the different types of masks: a surgical mask, an anti-pollution mask, and an N95 mask. Across the top is a logarithmic scale starting out at 0.0001 microns going up to 10 microns. The very bottom, you can see visible by the human eye is 10 microns and above. And a micron is 1/1000th of a meter. The N95 is the best mask, and it filters down to 0.3 microns. And if you notice just above it on the left, what's the size of the virus? They're 0.1. They're actually 0.08 to 0.12. But the masks are totally ineffective against a virus. That's why we don't wear them for colds. We don't wear them historically for the flu. Doctors wear them in operating rooms so that they don't exchange body fluids. They don't drool on an open cut or blood doesn't spurt up in your face. And you'll also note a little, just above the viruses is bacteria. Well, bacteria are up in the 1 micron range. And a mask is very effective against the clock just caught my eye. Let me continue on. Tell me when I've run too long and I'll stop.
18 seconds.
The pores on the N95 mask are 0.3 microns. These masks here are much bigger. We're up in the 1 to 10 microns. And the virus just goes right on through. Basically, the masks aren't working. There are no studies to show that they work. The doctors said they work. There's no empirical studies. And what we listened to from Maine Health was what I'd call establishment doctors. They're part of an organization. The non-establishment doctors are given the truth on COVID and should be administering. One of the questions I would have for those doctors, what are they giving these sick people? Are they giving them ivermectin? That's what they should be giving them. If they don't, they're going to have the hospital full of sick people. So anyways, as far as mask, There's been, the cruise ships have started sailing again, and all the cruise ships going out have at least 95% of the people vaccinated. And that's because they got kids on there that aren't vaccinated. But basically, all the adults are vaccinated. They're all wearing masks, and there are 86 of them right now who've had breakouts. So tell me about the masks or how the masks are working. We could talk about the vaccine, but that's a whole nother subject.
Would you mind wrapping up your comments?
Pardon me?
Would you mind wrapping up your comments? Just 'cause we're out of time, so if you don't mind
I'm
wrapping
sorry.
up.
Oh, finally, I'm very in favor of the mask versus no mask being an individual's decision. And the business in town can make the decision how they want to treat their customers. I know I've gone to Portland the other day, and as soon as I walked in, I turned around and walked out. They wanted to put a mask on, I'll go somewhere else. Thank goodness Freeport doesn't have a law like that.
Thank you, Mr. Hughes.
Thank you. Yeah, I could talk for another hour.
We know, Jim.
I'm against it.
Thank you. I appreciate your comments. Anyone else here in the room who has something to share before we move to the Zoom audience? No, I guess it's time to go to Zoom. So do we have anybody, if you're on Zoom and want to speak, use the raise hand feature, which should be in most cases at the bottom of your screen. Do we have anyone whose hand is up?
Got
Looks like
one.
we do.
Got Jenny, I'll put you live.
Okay, so Jenny, you are up.
Can you hear me? Am I doing, okay, here we go. I just did a quick, look up proceedings of the National Academy of Sciences of the United States of America. Says the preponderance of evidence indicates that mask wearing reduces transmissibility per contact by reducing transmission of infected respiratory particles in both laboratory and clinical contexts. I went to the grocery store this morning, and I go as early as I can because they used to have older people, or susceptible people time. And so I went there early this morning, and I was surprised to see how many people were not wearing masks and seemed to not understand that they were putting me at risk. I know that restaurants are able to keep people from smoking indoors, and they're able to get people to wear shirts and shoes indoors. And there's many other regulations that restaurants need to do in order to keep their customers and their employees safe. For me, my husband and I have not gone to a restaurant for 2 years. We used to go to a restaurant twice a week. So we would be going to restaurants if all the employees were wearing masks, if the spacing was safe, if there's same thing with grocery stores. I've been ordering groceries online because it's scary for me to go to the grocery store. There's so many things that I would love to be able to do. I'd like to be able to go to the Y and go swimming at the Y, but I'm afraid that they don't have people wearing masks in the gym room, and I don't want to walk through a cloud of virus particles. And from the research I've read, some of those virus particles can stay suspended in the air for hours. In the pool, it's not so bad because you've got the chlorine there that kills the virus, and they have more spacing for people in the pool. But in the gym room, really it puts people at risk. And I have a son-in-law who got COVID. He was vaccinated, but he was working in an environment where people do not wear masks. His case was really mild, but he was not wearing a mask when he went grocery shopping because he didn't understand how important it was. And so one of the questions that I asked him and that I wonder is, did he infect somebody else? Maybe somebody like me that has is older and that might be more vulnerable to the virus. So I strongly support the mandate because I think it helps people understand, just like with smoking cigarettes, just like with other, just with washing your hands when people are working in restaurants, you're supposed to wash your hands after you go to the bathroom. You got to wear masks because right now we're in this emergency situation. Our daughter works in a hospital and she doesn't like to talk at all about what's going on in the hospital because she says it's all COVID all the time. I don't want to talk about it. I need a rest. But lately she's been talking about it and saying how exhausting it is to watch people die that way. And so this is not an opinion, or this is not just somebody, doing what they feel like doing for themselves. I wear a mask to protect you and to protect all of you from getting COVID. And I really want the people around me to have the same consideration for my life and my health, so that we can just stop this, end this pandemic as soon as we can. I don't think that the mask mandate needs to go on forever, but I think that it will really help us, reduce the number of people in the hospital and make sure that if we get into a car accident or somebody has a heart attack, that they'll be able to get the care that they need. Thank you so much for considering this mandate.
Thank you. I appreciate your comments. Thanks for sharing.
There's no way to let somebody comment without you doing an echo.
Yeah.
If I don't turn them off, and I hate to
Yep.
feel like I'm turning somebody off mid-stroke, so.
Yeah. So is there anybody else in the Zoom world who would like to raise a virtual hand and share your comments? We have room at the virtual podium. Don't be shy. All right, I don't see any hands up, so if anyone else wants to speak or has an opinion to share, now's a good time to do it. Well, I'll give that one more minute for anybody to change their mind and speak. I'll just sort of talk about the logistics. This is before us tonight as an emergency ordinance because we felt it needed to be passed without the normal 2-week process to set a public hearing, have the public hearing, and pass a regular ordinance. As an emergency ordinance, it requires the vote of a majority plus 1, which for us would be 5 councilors. We need to vote for this in order for it to take effect immediately. So that's what we'll be up against. I don't see any other hands up in Zoom land, so I'll bring things back up to the dais here, as I'm sure that you all have questions, comments, and opinions to share. So who wants to go first? Councilor Fournier.
Thank you, Mr. Chairman. Dr. Petrillo, Mr. Petrillo, I'm wondering, would you be willing to put a sign up that says we highly encourage masks to be used in our establishment to help maybe trigger? I know for me, sometime I'm an old guy, and just the other day, I work in Brunswick part-time, and I walked into a store, and guess what? My brain didn't kick in, but how I was greeted, I really didn't appreciate it. So I'm trying to find a balance here where maybe that would trigger me walking in there with a sign at the door to put my mask on, because I totally forgot it, and then I had a not a pleasant experience. So I'm trying to find a balance here where we can take and say, okay, folks, please look at this, because I think we need to get over this, but I do think we have a lot of adults and a lot.
I agree 100% with that. I've heard a lot of stories like yours about people who agree.
Don, I'm sorry, going to ask, if we're going to get into a dialogue, we really need to have you at the podium because the rest of the audience can't hear anything you're saying.
Daryl, yeah, and I'm glad you brought that up, because I've heard that many times from people that they're greeted unpleasantly about the mask mandate, and I understand that. And I wish I had more time to comment earlier. That was one of my next points, is that I do think that if the town council were to come out with a strong recommendation for masking, that I think that most businesses would comply with it. I have a sign up at my restaurant that recommends people wear masks. They're not required. And I think that the vast majority of businesses in town have a sign that does recommend. And I think that maybe some kind of a statement from the council that encourages a conspicuous sign that suggests that people wear a mask, that strongly recommends wearing a mask. Maybe something from the town, maybe just a simple email from the town with something that people could print off that's a letter-sized piece of paper with the picture of the mask, make it easy for people so they can print it up themselves. All they have to do is get the attachment from the town, press the print button, and there you have your sign, your ready-made sign that can go right in your business window. I think that's a great idea.
Thank you.
Yeah.
Any other counselors have comments?
Yeah, I'll tell you right now, I'm not for this, for all the reasons that they said. Two, I think it's gonna be very expensive for the businesses to imply. I think it's very hard to police this. We're gonna have the police, what, are they gonna stand on the corners and watch and walk around town? So if we can't do that, then there's no point to this. We also have this, thank you very much for this, this is very helpful. These masks don't work. I just lived through a month of COVID with my family. It started with my son, went to my daughter-in-law, they all wore masks, and she got it. So I got tested, I was negative. My other daughter and son were positive. My wife was negative. Tested again to get a okay to go to work. My wife positive. I did not again, and I just got tested on Friday. I'm not positive. I'm negative, and I've been negative the whole time. I don't know if I had it in the beginning, I didn't know. Anyway, so that's it. Living in my house, and we weren't, they weren't locked in their rooms, okay? So I did not wear a mask. This sign here shows the mask is ineffective at best. When the doctor talked about what they're doing at the hospital, they're wearing gloves, they're wearing goggles, they're wearing an N95 mask. So if we want to protect everyone from getting this disease, and I get trying to slow it down, then we need to have everyone wear goggles, wear gloves, wear masks, but not just any mask, and not N95 or something better. And it's a feel-good policy. I feel not needed. I love the fact that the businesses put it on there and they have the opportunity to do that and say, if I'm asked, I will comply. If I'm told, I won't be coming to town because I don't want to be in that environment. I hate wearing this mask. It's not me. I don't have a beard for the same reason. It's not that I can't grow one. I can, although it doesn't look as great as that. But I'm just against the state telling us what we have to do. If you are terrified of this disease, and I get it, there are a lot of people, or you have a compromised immune system, what you really need to do is not come to town, find someone else to help you get your business. If you can't find someone, call the community center. There's plenty of people that will willing to help you get your thing, get whatever you need. But to force everyone to wear a mask because you're afraid is the wrong approach. That's my 2 cents.
Thank you, Chip. Anybody else? Matt?
I got to tell you, I'm 100% in support of this. I think it's the least we can do as a town. I do want to go on the record saying that we received numerous emails in support of this, had really well thought out arguments. I think we've been dealing with this for 2 years. Everyone's tired of it. But if we don't actually do something, we're going to continue to live with this. And I don't think it's fair to say, if you're afraid of this, stay home. It's a public health. We have to do what's good for the common good, and we need to move past this. And I'm in support of it.
Thank you, Counselor. Counselor Fournier?
I'm opposed to this as it's written this evening. I think we need a positive approach. I think it shouldn't be a punitive approach. And we're learning more as we go each day. I'm so encouraged by the numbers coming down. I read an article how Sweden did not wear a mask, and yet they're a little bit better than we are as a country in the United States. So I'll be voting against this evening.
Thank you, Counselor. Anyone else? Counselor Daniele.
I just want to point out that it does say in here, time period from January 18th, 2022 until February 16th, 2022, unless the ordinance is repealed by the town council, to Don Petrillo's comments earlier. So that is in there that we can take this away. Dan, can you speak to the teeth of this a little bit and how you envisioned crafting it a little more?
Yeah, I can try.
And let me be specific, because I'm hearing from two counselors that a strong recommendation from us would be acceptable, and I'm wondering, how much further does this really go than that?
Yeah, it's a good question, and there's, like I said before, or implied, there's a lot of nuance. The two specific things that the draft before you mandates, one is that the owner-operator of a business needs to post a poster at the entrance and the window saying that masks are required. The other mandate is that people, individuals, are required to wear a mask. Those are really the only two mandates in here. That the business owner has to post a poster and that the individuals have to wear a mask. That's it. For enforcement, I'll let the town manager speak because I know he's had conversations with the chief about it. My intent, and I'm open to other ideas here if we want to direct the manager otherwise, but my intent is that this is, it's a graduated enforcement. So the first time this happens, it's going to be a, would you mind putting a mask on, please? The second time it happens, it's going to be more of an educational approach. If we do need to call somebody in to help enforce it, it's going to be a, hey, did you know we now have an ordinance? It's not an ask anymore. And you really need to wear a mask if you want to stay here. I don't think that, you know, the day after we enact this, the police are going to be writing $500 tickets for everyone who's not wearing a mask. I don't think that's the intent. I think the intent is for them to come and explain that we now have a mandate, like Portland does, like Brunswick does, like South Portland is considering tonight, and like Bath will be considering tomorrow night. So it's an education to try and encourage people to follow the mandate rather than a strictly punitive, you know, start levying fines here and there. We did need to put some teeth behind it, otherwise it's going to be completely ignored. So if somebody is habitually, intentionally, aggressively, you know, not complying, then yeah, there is an option to levy some fines. Does that answer your question?
Yes, thank you. And I'll just say that my girlfriend works for the emergency department, and she's a nurse, or in the emergency department, and she's a nurse. And I see the toll that it takes on her, how she talks about work, and I don't like wearing a mask. I don't think it's fun. But if this is a way that I can help the people who are trying to care for everyone, and if the emergency department is normally an hour wait, but right now it's 8-hour wait, that means that we're all not getting care and that our healthcare system is struggling. If you need to go in to use a ventilator, not because of COVID, you can't. All the ventilators are used, so things that we used to be able to treat are now being left untreated. So I think this is a gesture towards everyone in our healthcare system saying, we see what you're doing, and whether it's the most effective thing or not, I think that at least we're all thinking about it, we're showing our support, and maybe people are washing their hands more because of it. So I'll be voting in support.
Thank you, Councillor Daniele. Councillor Bradley.
Yeah, first, whoever it was that invited the hospital here today, I thank you. Because I think that put, for me, the significance and the severity of our current situation in this community in stark profile.
Ed, if I could, I just want to be clear. It's very timely that they were here, but they asked to come on their own after our last
Thank
council
you
meeting.
for coming and asking to come. I just don't care who, I didn't mean to say that somebody set this up for this hearing, but I said because they were here, it put things in stark profile. I also want to say that I really respect and appreciate the people who oppose us. I mean, the people who are in front of us are some of our most respected business people, and they made points. I'd like to address a couple of them because I'm not sure that the points that they raised in Dom, let me start with you. You know, you talked about it's ridiculous to have a business enforcing this. And I agree with that. And I didn't start agreeing with that. I mean, I started hard thinking, boy, if you want a mandate, you better enforce it, you know, and you better not have, and the only people I can figure out who are going to see this in real life are the businesses themselves. So I thought maybe there should be a requirement, not only just to put up a placard, but if not to enforce it to the customer, at least put a requirement on that they call the town and say there's somebody in here who's not wearing a mask. That isn't in here now. Okay, so the businesses, it's just as Dan said. You know, you're free to decide inside your business how you handle the maskless person. and for anybody who's there, but you yourself have to observe it, okay?
Right,
And
so,
my point is only that the point you made is.
And just to respond to what you said about what I said, my question is, Dan and Ed, so Dan, you went on to explain exactly how that process works, how somebody will say, well, now, you do have to wear a mask. Who says that?
You don't have to, and that's
Who says
it? We don't, maybe no one. And that's the problem with this, it's the problem with this ordinance.
What's the point?
The
whole thing. And if these don't work, what's the point of the whole mask mandate anyways?
That's another question.
A gesture, as Councilor Daniele mentioned, because that doesn't make sense either. We don't need a gesture to help sick people.
Let's let Ed finish his comments and then.
I'm just trying to give you the respect of saying that I heard what you had to say, and I think that the ordinance deals with the concern you raised. You do not have to enforce this as a business. And if it did, I wouldn't support it after having thought about it, okay? So I just wanted to give you, in your point of view, credit and credibility in this discussion. So that's all. The rest of it, I don't have with you yet. I would like to say one more thing to Andy, because I also respect him over the years, what he says and how he thinks about things. And his concern is that, kids can't wear masks. You can't make kids wear masks. It doesn't make sense. They have to, his point, I think, was you have to see what's being said. Well, this doesn't apply to kids. And I just want to say that, too. Yeah, but it's specifically exempted from this ordinance. So I just wanted you to know that and to give credit to what you had to say. So we've exempted the kids in school, but... I don't know that.
We don't make the rules.
We don't make their rules.
There's a separate board that makes the rules for the school.
I just want to let you know that your point is given credit in this ordinance. And I wanted to acknowledge that on the record. Okay.
Is there going to be a metric that traces whether it works or not?
I don't know. I don't know.
It's sort of black magic what you're creating here.
Yeah. Well, to the point that it's just a gesture. It's a clear indication if this is voted for, and I'm going to vote for it, just so you know. It's a clear indication that the leaders of this town, who have been elected by a lot of people, maybe now who want to recall us, I don't know, think that making a... I know. and I'll sign your papers. So it is that we feel strongly, because of the sorts of things that the hospital said to us tonight, that we should make something that's enforceable. How you enforce it, it's like everything else. We have a speeding limit on the highway, but people don't stop cars that are speeding and force them off the road. They don't even call the police. Sometimes they just speed. And you know what? Is that just a gesture? I don't think so. I think most people are law-abiding, even those who don't want to wear a mask. 85-90% of them will wear a mask that weren't going to wear a mask because of this ordinance creates a law to do it. I just think that's what's going to happen. There will be some that don't. And what happens in those circumstances is a concern to me, too. It may be that a business gets into a confrontation with a customer because of this. It may be that customers get into confrontation with customers because of this. All of those are good points. But when I think about the whole thing, the situation we're in, the hospitals are in, that our families are in, and we are the leaders of this town, I think it's time for us to say something firm, clear, with all its warts and defects. And I appreciate your coming forward and pointing some of them out, but I'm going to vote for this. Thanks.
Thank you, Counselor. I'll offer a few thoughts. I hate wearing a mask. I'm always grumbling about it. But I recognize why it's a good idea for me to do it, so I do it. Our ordinance draft here is only for 30 days. It's going to, if we don't do anything, it will expire on February 16th. There is a chance, I don't want to say a good chance, a bad chance, because I'm just going to look at where the numbers are for me anyway, but there's a chance we may decide to extend it for another 30 days. But as of now, it's only for 30 days. Other towns are doing it for longer. We have the capability to do it for 60 days, but we've chosen to only do it for 30. We can repeal it, like Jake has said. So at our next meeting or at another special meeting, we can always say, hey, things are looking up. We don't need this anymore. We can get rid of it. One of the things that struck me as important is we can request, we can ask, we can suggest, we can strongly recommend, but there is a large contingent of people that will say, if I don't have to, I won't. And I think this is meant to address the bulk of those people. We're not going to get 100% compliance. I have no dreams that's the case. I don't think we'll get 100%. If we're at, let's say, 50% compliance now, if we get to 70%, 80%, 90%, 60%, that's still better than where we are, and that will help our population, that will help our residents, that will help the hospitals be able to provide care. I've got two relatives, my own personal anecdotes. One who has been waiting for a joint replacement for months and has had it rescheduled twice now because the hospital is overwhelmed with COVID patients and doesn't have time to do his joint replacement, so he is in 2 months more worth of pain than he would otherwise be. I had another relative who had a quadruple bypass delayed twice because the hospital didn't have enough capacity because they were dealing with COVID patients. That to me is pretty serious, and anything that I can do in my position to help our healthcare system cope with this once-in-a-lifetime event, I'm going to do. I get that some people are going to be upset. I get that some people are going to be angry. But I feel like it's my duty to do that and to listen to the comments that I've gotten over email, over Instagram, and certainly by voice. The other thing I wanted to mention is, and I think everybody knows this, but I'll say it anyway, that while it's a personal choice, whether you choose to wear a mask, that choice affects other people. It affects the other people in the room, in the store. It affects people who will wind up seeking medical attention. So it's a personal choice, but it's also a community choice, and it's a choice that we have to make as a community. Not everyone is going to support that choice, but nonetheless, it's one of these things we need to do for the community. I feel like having the mandate in place will offer some comfort to people who are in stores and are uncomfortable approaching other people saying, would you please wear a mask? I'm in a vulnerable position, but I have to buy my groceries anyway, so I have to be here, but I would appreciate it if you wear a mask. And if the response is, well, I don't need to, that puts that person in an awkward situation, and it puts them in a dangerous situation, frankly. So this gives them some comfort, knowing that they can certainly make that same ask. Now they have somewhere to go if things don't go well, in the polite way. There are other ways of dealing with it now. I did talk to a handful of business owners. It wasn't a comprehensive survey, but a handful of business owners who all kind of came back saying, with one exception, thank you for doing this. Thank you for offering it, because it makes my job easier as a business owner. I don't need to convince people of my opinion. I can just point to this and say, well, this is the rule. I didn't make the rule. This is just what the rule says. So thank you for doing that. I just don't want to have to be in a position where you're going to come down on me or come down on the high school students that I hire if they're not enforcing it harshly enough or gently enough. So thank you for not making me do that. I think that's all I've got to say. I'm sure I could go on and talk for an hour as well, but I'll be respectful of everyone's time. So with that, are there any other comments? Councillor Daniele?
Is there a way that we can modify it slightly to have businesses opt out? And I mean very slightly, like for instance, could we just put in restaurants could choose to opt out if they put a sign up that says this is, we have opted out, and publicly disclose that or something? Is that something the council would be interested in? Because then it would be all of our choices to go into that facility. And I'm saying this because when I talk to people at the grocery store, those cashiers told me, yeah, it would be really nice if everybody masked up and everything, and we all have to go to the grocery store. But we all don't have to go to a specific restaurant. Is that something, that people would be interested in, or do we not want to consider something like that?
Council Pillsbury.
I would just, I appreciate, actually, I just want to say, I appreciate the civility that we're showing, having the dialogue. We may not always agree. It's part of the process, and I think it's a really important one that's being lost today. To your point, though, what about the employees that need to have that job but are unable to pick up and go someplace else?
I would say in today's environment, let me ask, would either of you be able to hire somebody tomorrow?
I haven't been able to hire anybody.
Yeah. Yeah.
So to the point of, could somebody get a different job? The grocery store is hiring, like there are a lot of jobs. And if we were really targeted in who we allowed to exempt out of this, and I say this as, again, my girlfriend's a nurse and I almost feel bad doing this, but if it would help out some people, and we've heard from our business community that this could be a problem, and there are a group of people who would like to not have masks. I'll stop.
You all know, right, that this mask doesn't work. We should put a very specific, if you're gonna pass this, it's gotta be an N95 and you gotta wear goggles, because if you don't, you have a chance of getting this. This mask doesn't work. I just lived through it and we were all wearing masks and we still got it. So I don't understand. I get it. It's a nice gesture, but the road to hell is paved with nice gestures. And I think it's gonna be very costly. And I think people won't come to town because of this, unless every town around us does it and they have no place else to go.
To the point of the masks don't work, the slide that was up from Midcoast showed that if I wasn't wearing a mask and the person that had COVID, in 15 minutes I could get a high enough viral load.
Right.
Wait, but so if I'm wearing an N95 and they're wearing an N95, that doesn't mean there's a 0 chance that I could get it. Of course the virus still gets through. It's an N95, not an N100. But it could take many, many hours. So the point of, if I was wearing this mask and you were wearing this mask and we sat next to each other for 24 hours, could you get it from me? Absolutely. Because we were in the same confined space for a long time. So it's not unfathomable that if 2 people lived together, that over the course of 2 weeks, the viral load could be high enough that you could pass it along. But for going to the grocery store, what's the probability that enough viral load gets through? Because the holes may be this big, but there are also still parts that catch. I mean, and I'm talking as not an expert, but my point is if I'm at the grocery store and I'm wearing this mask and everybody else is wearing this mask, I believe, and maybe we can pull that screenshot up from before, that for the hour that I'm there, I'm very protected. And that's what I'd like to add.
I wrote it was 15 minutes, 20 minutes, 30 minutes, 1.25. If you have nothing, you've got to be talking to someone like this for 15 minutes.
Starting to get scared.
Close contact.
Yeah.
That's what it said there. If you're wearing a mask, it's 20 minutes. If you're wearing this mask and you have a 50%, it's 30 minutes and it's 50% chance wearing this mask. That's what that slide said. So,
but it was a chart, not just one row. So that was the
that's true.
No
But that's one
mask
one person wearing no mask, and it was a little different if you were both wearing a mask. But still,
well,
how close are you to people in the supermarket? I mean, I don't talk to any. I'll talk to my friends, but.
But what about the workers who are there, who are on the line? So, your viral load plus the other person's,
Right, but they have a screen in front of them. If you're talking to the cashier, and if they're stocking shelves, they can move. I mean, so anyway, I get the gesture, but.
Yeah. Councilor Fournier.
I wish the state CDC or whatever would have come out with some sort of guidance that we all would have, a reasonable expectation to follow. But we've been through the whole process, have been here or there. We're finally going to see that. So thank you.
I wish they would too, so we wouldn't have to have the discussion here. Yeah. Yeah, I did say before that I would let the town manager speak to enforcement, and then I proceeded to kind of give my own opinion of how I think enforcement should be done, but I know you did have a conversation with the chief, so it might be a good idea to share some of that.
Yeah, there's only a few things I'd add to what you said, Mr. Chair. The enforcement, what will happen is indicated by what happened when this happened about a year ago, when we had an active mask requirement in town from the state, which was enforceable. And I think how that was responded to should be taken as an indicator of what would happen this time around. I don't think we wrote any individual tickets. There were several instances where there was education that happened. The police were called by shop owners primarily, but also some patrons who saw people not wearing masks indoors when they were required to. A lot of the calls that we received were from people that are like, hey, I've got somebody who's refusing, and you see these on YouTube, right? You can't tell me what to do. It's, it's a private piece of property, right? And that's reflected in this ordinance, is that there's still trespassing laws in effect. And if a shop owner or a business owner wants somebody to wear a mask, even if we don't make the requirement, that's still enforceable. That was a large part of the enforcement last time. So that's expected to be a large part of the enforcement this time around. I do think the question was asked of me, would this impact public safety negatively, from a negative perspective? There is not an expectation that these will be like Alpha 1 priority calls, drop everything if somebody calls in a mask violation at Bow Street Market. The police will respond every time that there is a call, but if there is something life or death that is going on that's different, that's going to take priority. If there's nothing on the list, they're going straight to the call. That's how it will be handled. So will it add workload? Yes. Is it going to impact anything, a life safety matter? No. They triage calls already, just for the same reason you don't go, or the ambulance doesn't go to, a broken arm when there's a car on fire on the interstate. So that will happen in this case as well. So will it be extra workload? Yes, it could be. Will it be an impact to policing ability? No, it will not. Is it expected that these things, that tickets are going to be issued like hotcakes? No, it's not. In fact, the chief said that they've talked about this extensively when this happened before, about a year ago. And given the officers very clear guidance on how to interact with people, not to escalate scenarios over a mask, that it's not worth creating an issue if there isn't an issue. The only way that this could really be escalated if somebody refuses to leave a piece of property and the property owner wants them out of the property. That could be a scenario where it could be escalated into a police matter. If a business owner doesn't want somebody gone and they refuse to put their mask on, they might be issued a ticket, but they may not be asked to leave the property. That could be one outcome. If a business owner is like, no, I'm okay with them staying, I don't want to lose business, I don't want to hurt my customer base or whatever, they could still be issued a ticket, citation under the ordinance, and not trespass from the property. So a lot of it is going to have to do with how a property owner wants the town to respond to what's going on their property, which is hopefully, this isn't, all out. This isn't a way that we could go, and I think Councilor Bradley hinted at it, that it could be a lot more stringent. There could be enforcement mechanisms where you're required, and if you don't do your due diligence to report it, you could be found, in violation of this ordinance as well. That intentionally was not put in here. It gives the ability to enforce things if a bystander is concerned, or if a shop owner or property owner is concerned, but it doesn't necessarily require it. We do think there will be quite a bit of people that will be reporting those things, but it's not a mandatory requirement under this ordinance. So it tries to strike a middle ground. There is the potential for conflict. I think some business owners were very concerned about what you mentioned, Mr. Chair, which was our employees are not comfortable having an interaction, having a confrontation with somebody, and we are desperately trying not to make that happen. So if the direction to your employees, if you're a business owner, is, don't go out and get into a fist fight or get accosted or get assaulted by an angry patron, that's fine. And we expect that some people might tell their employees that. If they want to do a report on the sly or let people know or do it in a way that doesn't endanger their patrons, that's allowable too. If a patron's in a store and wants to call the town, wants to report something, that's okay. If you're not comfortable doing that, I don't know if I was in Bow Street Market and I saw somebody not wearing a mask, I'm pretty comfortable about my safety. I don't know if if I was in that scenario, call somebody. It's a personal decision, and it's putting a lot of it's actually putting more personal decisions on a lot more people in this ordinance than probably what's thought. So that's how I got comfortable with it, is kind of trying to strike that middle ground.
Do you think there's any added cost to the town to implement or enforce this as written?
Added workload.
Workload, but no added cost?
Well, it adds cost because it's workload. It's more.
Well, but we're not gonna have more people on a police shift than we would today?
We do not plan that, no. And I think that if that became an issue, I think you'd probably hear about it from the police chief and myself, around the time that this would come up to be dismissed or be renewed. I think we'd probably let you know, like, hey, it's been a nightmare for the past 2 weeks, and we haven't been able to get anything done, or these calls have been piling up. I hesitate to say there's no cost on the town, because if there is a citation that's issued, and if we do decide we want to go, to court over $500, there would be some costs there, like any enforcement action. If it's a violent act that has nothing to do with COVID, there's still a cost to the town to enforce the criminal code there if the police officer has to go to court or something like that. So,
We didn't have any situations like that last time.
we didn't, but it's not a good analogy, because there was some state enforcement arms behind this.
Yeah.
And for example, like restaurant licensing, shop owners, a lot of these calls were referred. We took them, we reported them, but a lot of them were referred to the AG's office, and some of them were handled in-house through education. So I would say maybe half of them were dealt with by the town, the other half were referred out to,
Can I make a suggestion that might add a little bit of cost, which is in Portland and in Brunswick, they've offered a version of a poster that business owners can download and print and put in their windows. I'd like it if we could do something similar. And then also, if a business owner doesn't have access to be able to download and print, that maybe we have a few copies here.
Sure.
They can come in and pick one up, which will add some minor cost, but
Yes.
if we could do that, I think that would.
Yeah, we were planning on doing a very similar, should this go forward tonight, a similar setup. If you look at Brunswick's website, they've got like a one-pager that you click on the banner up on top of the website. It says, this is, all the FAQs about the mask ordinance, and then, the actual text is below, and there's actually a downloadable, we could even, steal that template and put by order of the Freeport Council instead of by order of the Brunswick Council. I'm sure that they're not going to take action against us for that.
Yeah, I wouldn't mind, for the other towns in the area looking at it, I wouldn't mind if everybody used a similar looking poster so that it's clear that, I know what that poster means. I've seen it in another town, so, I get the gist of it.
So two things I do want to point out in here that I think merit a little bit of deliberation, not like you haven't already had a lot of deliberation, but the dates in here, those were just a stab at effective dates that we put together. If the council feels differently, those can be modified. It's proposed to go into effect tomorrow, with the posting requirement being a week from now. I think that was intended so that it would do something quickly, but understanding that businesses might not get the word out. But then I understand the argument. The second argument to that is, well, what if word doesn't get out to visitors too? So that may require a little bit of tweaking. I don't know if there's a right answer. It's a political answer, I guess. The second thing is the fine. If the $500 fine is correct, and I've got a couple questions about it from both people in the community that have read this, business owners and counselors that have said, hey, is that the right amount? There is no right answer to that. If the council is comfortable with something smaller, that's an option. Like I said, we don't expect to be issuing a lot of these tickets, and only in instances where there's an outright refusal to follow a directive. So I may be worrying over something that's not really going to happen, but in any ways, we had a conversation about this before the meeting out in the hallway. This all relies on a judge saying that what we're doing is just and fair. If we try to take civil action against somebody for $500, a judge might say, hey, it's only reasonable to impose a fine of $100. That's not going to be on us.
Yeah, I hope that we issue 0 summons for this and that we never collect any money. That's my sincere hope. I got comfortable with the $500 because that's what the other towns who have done something similar have done. So that's, I think, where that came from. But certainly open for discussion. Councilor Lawrence.
Yeah, just two things. The cost, I wasn't just talking about cost of the town, I was talking about cost of the businesses and losing their workers because they don't want to do this, or people not coming to town because they don't want to deal with having a mask. So those were the other two costs. And is there a way to track how this is working? Because the whole thing is to stem the spread, how do we track that? I mean, this is why we're doing this, so how do we know we're being effective?
From an operations standpoint, we can easily report back to you how many, how many calls we got, how many
I'm not
actions.
talking
how many-
about the mask being on people, I'm talking about stemming the spread. So if next week or 2 weeks or 3 weeks, the thing keeps going up,
Yeah, I
still
don't-
wear the mask?
I
Or
don't
do we
think you
say,
can-
you know what, we can't fight this anymore, this is.
I don't think
I'm
you
just-
can do that without the 5G tracker chips that we're trying to put in everybody.
Oh, so we gotta get the water tower done so we can get the antennas on.
No, but I mean, I'm
well-
jesting, but I think the problem is that you don't know who from where is here and where they go after they leave here. And it's hard to make a scientific finding that we're being effective if, it's a bunch of people from Gray, New Gloucester, Lewiston, Freeport, South Portland, and South
So
Dakota.
we can't track whether this is effective or not.
I mean, unless you can track who is being subjected to this ordinance, you couldn't make a scientific finding on it on whether it's effective or not.
That was my question. So it's fairly unenforceable and we can't track the effectiveness.
Yeah, I think we'd be lying to say you can track the effectiveness with the resources we have now.
But the people who dissented or the people who gave comments negatively said we should just highly encourage, which in effect is what we're doing, right? I mean.
Oh, no, we're saying you have to, not encouraging. And with any mask, not the ones that it's effective.
Yeah, I think my point from before is that we will achieve greater compliance, but not 100% compliance. So doing nothing, this is better than doing nothing, in my opinion.
And in mine, it's not. So we're going to have to agree to disagree.
Yep. Counselor Daniele?
Is there any move on the council to allow potentially places of business that would allow their patrons to be maskless, to allow their employees to be maskless as well? Okay, I'm crafting that to say that a restaurant, because the people that they're serving would not be wearing a mask, why are we making the servers wear a mask? I'm just asking if the council would be interested in doing that, hearing from just going back to my original question.
Counselor Bradley?
I'm not interested in doing that.
Counselor Fournier?
I would like to see an option to give the business a way they could run their business scene appropriately. And June spoke that she has not had any issues down at Sunrise serving her people, so they've done a good job. She's going to continue to do a good job, so I don't know why we should tie her hands.
I do think that would be great. I'd still vote against it because I don't think we should have it at all, but I think that would be, let the business opt out, I think that's fine.
Counselor Egan?
I appreciate your effort to try and find a narrow path to walk, Jake, and I would echo what Matt said about the tenor of the conversation. It's actually refreshing and encouraging sitting up here to know that we can have a pleasant and cordial conversation, treating each other with respect. I don't agree that there should be a place for a particular business to opt out, because I don't think we're in a position where we decide where that line is. Only this business can, and what if, the art gallery contingent, I'm making this up, comes in and says, why do we have to have masks on in our art gallery? There's only 4 people in here at any one time, or, whatever the argument might be. Then, so I just feel like if we get onto the slope of deciding which business may be able to opt out, I think that puts us in a very difficult position of saying why we say yes to them and no to others. And I appreciate the challenges that the 2 business owners have brought forward. It's got to be exceedingly difficult to be dealing with this, and I don't have any particular expertise, so I'm listening to the health experts. I'm a community development finance person. You want to talk about how to finance your affordable housing, let's have a conversation. But in terms of how the masks or how long the mask has to be on, I'm going to listen to the folks that we had comments from at the beginning of the meeting.
Chip?
We're forcing everyone to participate. Why not have an opt-out? Because you could put on there, hey, we request you wear a mask, but we're not enforcing that in this restaurant. And that way, anyone who doesn't want to go in there and possibly get hit with someone not wearing a mask, they're making a choice not to go in. I mean, and we don't have to decide that. The business can decide that. And if the business decides, I wanted everyone to be masked, great. That's the business decision. They decide I want to opt out, fine. That's the business decision. And then it's the customer's decision whether they want to go into that store knowing that possibly there's going to be someone unmasked. But right now, we're forcing everybody to be masked because I still don't get why, because I don't think this mask works. Only because I lived it.
Yeah. But, yeah, for me, I'm not comfortable adding an opt-out clause because I feel like it makes the mandate not a mandate. It makes the mandate more of a request, which is where we are today, so we may pick up some businesses. The other thing that would concern me is that it might backfire by encouraging people to come and make a point of not wearing a mask, and encouraging people from other distances, other localities to come and say, I want to support this idea of opting out and not wearing a mask, which will have the opposite effect on our healthcare system that we're trying to address tonight. So if we attract thousands of people to come to a place that says, I'm taking a stand by choosing to not follow this mandate, we're going to have even more people in the hospital, not less. Yeah, Jake.
I think that allowing anybody to opt out is not a good idea, but if somebody can go to a restaurant and sit without a mask on, in my mind, when we're saying that the people who are not wearing a mask are the ones who are potentially affecting others, that means we're requiring the servers to wear their masks while their patrons are not. And to me, that's the line, right? That's where it's getting weird. And we're not being arbitrary about it. If the activity says, if the business activity says that you don't have to wear a mask while you're in the public building, then I don't know if the employees should. And I'm confused about this, so I'm talking it through with you guys. But to me, that's a pretty clear stance. Like it's not wishy-washy. It's not like we're saying, you know, LL Bean doesn't have to, but these people do. Like it's, if the person coming to patronize, thank you, doesn't have to wear one, why are we forcing the employees to? What is that doing other than encouraging the people who aren't wearing a mask to, like, it's protecting them a little bit, maybe?
If there were a way to require people to wear masks while they ate, I think that would be an interesting discussion to have. It's not possible. So I feel like there are certain categories that are excluded in this and every other ordinance that says if you're in a restaurant and you're eating, yeah, okay, you're going to take your mask off while you're at the table. So we have to make some allowances for that, but I don't want that to become a slippery slope and saying, well, if they don't have a mask, then the servers don't have a mask, and if the servers don't have a mask, then why should the cooks have a mask, and the cooks don't have a mask, and so on and so forth. So, you know, the exceptions are limited to the people who really are unable to wear a mask. Chip?
But I don't think it's arbitrary. Maybe it looks arbitrary from a town perspective, but if the individual business owner decides that he doesn't want to, I don't think it's arbitrary. It just makes it what that business owner wants to do for his store. And if he thinks he's going to get more customers because he's masked, great. Put on a mask is required, and this is how he enforces it. If he says, the business owner says, we request that you wear a mask, but it's not required, I don't see a problem with that either, and that in his business, you don't have to wear a mask. It just opens up the possibilities for everybody that either want to be masked or not masked. But right now, I think it's it is wishy-washy right now. Of course, I like it being wishy-washy, but it doesn't allow for any other options, and that's where my hang-up is.
Yep.
If the business owner wants to do it, I'm all for it. That's great. It's your choice.
Yep.
Move the question.
All right.
I
Question
move the question.
has been moved. I don't even think we get to offer final thoughts, do we? I think it's
You're gonna
more
take a vote on the motion to move the question. It's gonna be a second. You gotta take a vote, and that kills all communication, all deliberation. So you've got a motion.
You got a motion to move the question. Is there a second to the motion to move the question, which would essentially kill the conversation about it? I'll second that.
Now you gotta take a vote.
So let's do a roll call vote on that. Councilor Pillsbury on whether or not to agree to move the question.
I'm in favor of moving the question.
Councilor Fournier,
Yes.
Councilor Lawrence,
It is just time to vote, yes.
yeah, Councilor Daniele,
Okay.
Councilor Bradley,
Yes.
Councilor Egan,
No.
and I vote yes. So it's time to vote, is what we just decided by a 6-1 vote. So all in favor of the mask mandate ordinance as written?
Aye.
Aye.
And all opposed?
Aye.
Aye.
So 5-2. Motion passes. Thank you to the public and to the council for a respectful debate. I think that was as good as that could have gone, and I think a lot of good points were made, and I like the way the debate was handled. So thank you to everybody.
Thanks for coming in.
Yeah. Okay. We're on to talking about T-ball fields. Item 21-22 is about a request from the Little League to construct a T-ball field. So, Adam, do you want to give us some background on this?
Sure. My name is Adam Bliss. I proudly serve as your town engineer. And one of the hats that I wear is manage our wonderful assets and facilities, Pownell Road Fields being one of them. And in this case, I'm sort of the messenger or the marriage maker between a request from Freeport Pownell Little League to construct a Little League field at Pownell Road Fields. And so in turn, I reached out to some of the stakeholders, the athletic director, the youth football director, and other stakeholders, and we got endorsement for that request by Freeport Pownell Little League. In addition, the president of Freeport Pownell Little League has found a funding source to construct this field. That field will be at the far end from the parking lot, adjacent to an existing ball field, and its dimensions will be Little League size for T-ball type players, meaning we're not so concerned with balls flying, 300 feet down the foul line or into other fields and so forth. This request does come out of need, as Freeport Pownell Little League has been displaced from 2 of their existing fields, and this rather underutilized facility, which we've invested money in over the years, there's a great opportunity here, and I'll leave it at that.
Thank you, Adam. Councilor Egan?
I think it's a great idea. Thanks, Adam, for the presentation and the nice diagram. My only question was, do the Little League folks anticipate that there would be simultaneous games on this new projected field as well as the tired but existing Little League field that's in place now? Could they have concurrent games?
It's a great question, and we've had this type of discussion at the Hunter Road Fields, and so we have to define the problem. Is it a capacity problem or a scheduling problem? And in this case, it's a scheduling, not necessarily problem, but approach. We stagger practices and games so that we don't have these conflicts. And Freeport Pownell Little League, who manages all of the scheduling, is well aware of that.
Great. I'm strongly in favor of this because I'm well aware of the fact that the Freeport Little League has lost access to precious fields. And I know LL Bean has agreed to reconstruct one, but that's going to be a little while. So this is great that we can get this installed at the Pownell Road fields. Great plan.
Darrell?
Excellent, you found someone to build it. My question is, what will the maintenance plan be for the field once it's built?
Good question. This facility is a little different than Hunter Road Fields, where we don't have a defined policy or a maintenance agreement with the RSU. The current maintenance program is, it's essentially all the grass cutting of the field is essentially handled by the RSU. And my own thoughts about that are they have been the predominant users of that facility for football practice, football games, middle school football games, and some lacrosse practices as well. So I think the answer is I'm not anticipating a near a responsibility by the town in the near future.
That's the right answer, thank you.
Is there any money to help the existing field be spruced up a little bit?
Good question. We have, I think it was 2 years ago, the town partnered with the RSU, and I believe it was Freeport, it was the Youth Football League. We partnered to invest $30,000 into the Pownell Road fields, that whole football field, which is inclusive of the baseball field. It was tired, so we spent $30,000 to improve the turf and the soil and amending it. It has irrigation, so that it has that going for it. I'll leave it at that.
But has the baseball field received any of that? And does the baseball field get used very much now that the football post is in the outfield?
It's been my experience that the Freeport Pownell Little League does a lot of maintenance of their fields, and they do it by volunteer work. They do it because they're passionate, and they have, in my opinion, a great leader of that organization who cares.
Because I think that baseball field has, the dirt's not as good anymore. I don't know, like living across the street from it, it doesn't seem like that one's as maintained as the Hunter Road fields are.
Yeah,
obviously.
so context, I'm glad you mentioned that. Hunter Road Fields is, they're immaculate. And there are a lot of neighboring towns and towns throughout Maine that are quite envious at how well we maintain the Hunter Road Fields facility. Now, again, context, that facility is a lot newer. It has a very sophisticated drainage system, and it has just beautiful care given to it.
But so there's no additional money. When we build this, it will not help the Little League field that's there currently.
Not through this specific request, but if you would like, I can reach out to the president of Freeport Pownell Little League, or maybe you can, I can put you in touch with him.
I think most of the time that field, the current field, is used as practice space. And I think that's mostly what they're trying to add capacity for, is to have more practices and then reserve the games for the really nice stuff over at Hunter Road facility.
I mean, that goes directly back to the fact that those are maintained at a cost to the town by the RSU, but at a significant cost. So I think if we want to add something that looks like that, that costs $150,000 a year to make those fields look that way. Wouldn't cost that at Pownell Road, maybe half, it's about half the square footage, but that's kind of what you're looking at, that range. So.
Yeah.
Matt?
I will just say, as a parent of a child who played this past spring, the fields were in use all the time. We had a lot of practices there with multiple teams. The space was needed, so I think it's a good idea.
I've had 2 kids who've played on every field in town, and I can second that.
If I might add, greater utilization of this facility with its with which abuts the Hunter Road field facility, I think is a convenience for parents, that fewer parents have to go from way across town to pick up one child, or when there are conflicting practices and they just can't be in two places at once. So there's a grander vision to this, to make these adjoining fields better utilized.
All right, Councilor Fournier, would you read the be it ordained to get this item officially?
Certainly, Mr. Chairman. Be it ordained that the request for Freeport Pownell Little League to construct a T-ball field adjacent to the existing ball field be approved.
Second.
Thank you. Any other discussion? All right, all in favor?
Aye.
Any opposed? Unanimous, that passes. Thank you, Mr. Bliss.
Thank you. I'll pass the message along, and can't wait for warmer weather to play some baseball.
Yeah, and thanks to the Little League. They're a fantastic organization, and like you said, so dedicated. They spend so much time on those fields and just organizing everything. Lucky to have them.
The coldest day I ever spent was a summer playing baseball with my
It's always
kids.
cold. Every time there's a Little League game, it's always freezing.
It is. Oh.
All right, we are now moving right along up to item 22-22, revisiting the mitigation plan that we looked at briefly, I think, 2 meetings ago. And we wanted more time to study it. In the meantime, I think we found a couple of small changes. So, Councilor Lawrence, do you want to read the be it ordered, and we'll get it on the table?
Be it ordered that the Cumberland County EMA mitigation plan be adopted.
Second.
Thank you. Any questions? We've got Chief Conley here who can talk about this, maybe give us some context on what changed since last time.
Well, I supplied the manager a memo, it should be in your packets, kind of address some of the issues that you raised when we met a couple weeks ago. Councilor Egan's question on climate control issues and stuff. The county plan definitely has an interest in that and put language in the big plan. Some of the questions that Councilor Bradley raised on, financial impact and so forth, I tried to explain that and answer that in the memo that was produced. What I do have is I'd like to introduce Margaret Cushing from the county EMA, as she's the planner and probably much of the architect of this large document that's out here to help answer any of the additional questions that may, and give you a brief overview. But the risk for us not participating is outlined in the memo, is potentially having to write our own mitigation plan, which is hours and hours and hours of work. And 2 is that we'd have to submit it to FEMA for approval. And 3 is the potential loss of some funding that would be available to us for pre-mitigation. So but I'll let Margaret answer any of your questions, if I so be.
Thank you, Chief. And as you make your way up to the podium, I'll just offer a note of thanks for being patient, sticking around until 8:45.
First, I want to thank you for considering this evening. I do owe you folks an apology. The first round, when you read it, you did not see Freeport in the plan. That's because we went through about 15 iterations of the plan, and every time we did it, we had to cut and paste. And somehow or other, nobody caught the fact that 2 towns were missing from that. My fault entirely. I do apologize to you. Second, this plan is a requirement of the Federal Emergency Management Agency every 5 years. And the county assumes the responsibility in the state of Maine for doing these plans because we know that the towns do not have the time or the resources to put into writing one of these plans. It took my office about 18 months to do this. So there are hundreds and hundreds of sections of the plan that there are very specific regulations that need to be adhered to. And so we offer this to you as an opportunity for you to kind of get a free ride and say, yes, this plan is acceptable to you. And that's going to allow you, the biggest thing it's going to allow you is that if you need pre-disaster mitigation funding, And that includes a lot of climate change actions. And I know you folks participate in it, the 10-town consortium that's working on climate change. There are going to be projects that you derive from that could very easily be part of the what's called BRIC funding, which is the pre-disaster mitigation funding. And I hate to see you folks miss out on that. You can avoid missing out on that by one of three ways, like Paul was saying. One, you can approve the plan. Two, you can write your own plan. And three, now I've lost my train of thought. But understand that if you choose not to approve the plan, that's for 5 years, because that's how long this plan stands with FEMA. And while we will work with you every way we possibly can, FEMA is the one who says, if you don't approve the plan, you don't get funding. So I just want to offer that to you, not as a threat to you folks at all, but to simply say to you that we really want to help you in the mitigation process. We really want you to have the funding for it. We are more than willing to help you work on the grants. We have an excellent person in our office who's the grant guru. And so we offer you everything we possibly can. And but it is contingent on a signature. Now, ideally, I would love to walk away from here tonight with a sheet of paper, the template that's in your hands, with signatures from everyone here. That would be fantastic. Questions?
Councilor Fournier.
In my previous life, we worked with the county very much. We always adopted the plan, and if my memory serves me right, Hunter Road culvert was used for mitigation plan because of flooding down in the dip. And we worked through the county that so the trout could swim up through. That was done a number of years ago. And I also believe Desert Road, when that particular culvert was in, was also utilized by the plan. Paul doesn't have enough time to put a plan together, and we shouldn't add any more to his plate. The county has done a great job. I strongly support this and hope we get a unanimous vote tonight.
Thanks, Darrell. Ed?
I have no idea what kind of funding we're in danger of losing or gaining based on our decision tonight.
It is called BRIC funding, which is Building Resilient Infrastructure and Communities. Boy, I got that without looking at my notes. That is the new pre-disaster mitigation funding. So if you decide, let's use climate change as an example. If you decide that you want to build a jetty, I hope you don't, but if you do decide to do that, then you can get probably 85 to 90% of that, the studies, the engineering, and the work funded by FEMA, instead of having to fund that by yourselves.
So if we are going through a process of determining what kinds of things we can do to mitigate climate change in this town, there's a lot of people in town thinking about it. If they come up with a plan, we can get 80 to 90% of that funded.
You could conceivably.
Margaret, could you stand in front of the podium? There we go. Thank you.
It is
Then everybody can hear
competitive
the
funding,
conversation.
but there is a lot of money available right now.
How much money is available?
Millions and millions of dollars that FEMA has put into this. And the Recovery Act has put in even more money.
I'm sorry to interrupt.
I can't tell you the exact amount of money.
How soon do we have to apply?
I'm sorry?
How long do we have to apply?
For this funding cycle, that ended in December. But for the next funding cycle, when you develop your plan, when you decide what you want and you develop the plan, then bring it to us and we'll work with the Maine Emergency Management Agency to help you get into the next cycle of funding.
Thank you very much.
Matt?
Have towns in your tenure opted out? And if so, what's happened to them?
Actually, nobody has opted out.
It's actually sort of a fascinating document. I read almost all of it. It's pretty lengthy. And there's some pretty interesting stuff in there. So I thank you for making the effort to put it together. And I think it's something we can kind of ride your coattails on. So I'm happy to do that. Any other questions for Margaret or the chief? think we've already read this one in, so we can directly vote on it. All in favor?
Aye.
Any opposed? Passes unanimously. Thank you, Chief, and thank you, Margaret, again for coming, and thanks for your patience and sticking around and explaining it all to us.
My one request to you is that you do sign that document.
Yeah, do you have that
We
for
can
us to
take
sign?
care of that. If you want to wait 5 minutes, Margaret, we can get you a signed copy.
That would be great.
You can take the original and leave us a signed copy. Oh,
All right, while we're working on that, Councilor Lawrence, Daniele, could you read the next item of the be it order, and we'll start talking about, actually, I think we need Peter for that one too, so.
yeah, I'm just gonna, it says.
Yeah, go ahead and read it. And
Be it ordered that the appointment of Christine Wolf as Town Council Secretary be approved.
Second.
All right, I think there's a memo in the packet for this one as well. I am thrilled, because I was worried when Sharon left us what we were going to do, so I'm thrilled that we've got somebody who's willing to take on the onerous task of following us around and writing down what we say. Peter, do you have any other context you want to offer?
Yep, just very briefly, the official duties of the Secretary of the Council is outlined in the charter, in our admin ordinances, are actually split between kind of the clerk's office and what Sharon does anyway. Sharon does the record, which is the minutes of the meeting, but there is a verbatim record, which is actually the recording that right there that's being kept right now, that's done by the cable department, and Chris does the notices for the meetings. So it's split up 3 ways anyway, so this would put 2 of those 3 duties right in the purview of the clerk's office, which I think is great. Neither Chris nor I are 100% that this is the right solution, that it's going to work out. So she's asked for a trial period for many different reasons. She's not sure if we'll be happy with her minutes. We're not sure if she'll want to keep doing it. She's also not sure if she can stay awake, past 8 o'clock at night, because she's usually sleeps 8 to 4. So these are all things that we're just going to test out for the next 4 to 6 months or so. So if everything goes good, you'll see Chris at your meetings, and you won't hear anything. If for any reason there's a ton of good reasons why this might not work out, why we might want to just hire a minute taker. If that happens, we'll come back to the council and let you know. And I don't think there's any. I'm really happy that Chris is volunteering, so I don't think we should feel bad at all if it doesn't work out. So we could easily go back to finding. Well, I won't say Sharon 2.0, because nobody can be.
No.
Sharon, nobody can be Sharon 2.0.
If it works out, it's great. If it doesn't, this at least buys you some time.
Yeah. Thank you for offering to do that, Chris. I appreciate that. And thank you, Sharon, wherever you are out there in Zoom land.
She's out here. She's watching. I've seen her.
We will miss you, Tara. There, she's waving at us.
Oh, she's on the TV.
Thank you, Sharon. I wish you were here in person for us to thank you, but know that it's been it's a valuable thing that you do, and it's, I think, a testament that whenever the minutes come up, other than I think Councillor Bradley's first meeting on the council in this term, I don't think we ever have had much concern to change the minutes. So job well done, and thank you very much. All right, anybody want to discuss the item before we vote? All in favor of appointing Christine Wolf as our secretary?
Aye.
Any opposed? Didn't think so. Unanimously passes. Welcome. Good luck staying awake.
So we'll get you. It'll be easier because you'll be right next to Councilor Pillsbury. He can elbow you when you fall asleep right over there, so don't worry about it.
Yeah, he's a
I
lefty
hope you
too.
like the smell of coffee.
Love it.
All right. Thanks, Chris.
Yep. Oh yeah, you've got your next item has your name on it too.
does.
Councillor Bradley, you want to read the item 24-22?
Be it ordered that the following public peddler renewals for 2022 be approved. 1, Lily Perilla, doing business as Gwilyn Goodies. 2, Dale Baker, doing business as Nick and Noah's.
Second.
So we have 4 public peddler spots in Freeport. These are the 2 people that have been, that were there last year. So these are the 2 vendors that were behind Starbucks. The only reason I wanted to step up and tell you anything is that some of the documentation that we need is missing. Dale is going to not complete his unless he gets a spot that he desires. So if he does get that spot in the lottery, he'll complete the insurance binder and things like that. So just know that we don't issue these until we have all the documentation that we need, but that the applicants sometimes hold back pieces until they're assured of a good spot.
Counselor Bradley? Question?
I guess my question is, why are we considering it if the application isn't complete?
Because he's not gonna, you have a valid point, but he's not gonna go get insurance.
And he's not, but why do we? What brings it to us? Is there something that requires us to do this before he completes his application?
Timeline.
What's that now?
Is it the time?
Right, so this has to come to council for renewal. There's dates in the ordinance that require us to bring new applications to you and renewals in January. There's a certain time frame. So,
We all understand what the issue is, and I don't know how to handle it. So, I mean, we're renewing something that he is, I guess what I'm saying, if we're renewing something he's not required to do. What's the consequences of renewing him in this spot if he decides not to use it?
then it's open on a first come, first served basis. So if you have an applicant that applies and he even gets into the lottery, if he doesn't complete his application process, which is get his insurance, pay his fee, then that spot then is open on a first come, first served basis. So we're not out anything. They pay, like this applicant has paid $110 non-refundable application fee just to come here to the board and say, I'm interested in having my spot that, again this year, yeah.
And is there any impact?
No, Ed was talking.
I just have one more question, and I'll shut up. It's on. Thank you. Thank you. That is his doing this keeping anybody else from getting into the line for this spot?
No, because on the time schedule that we have, people that have held it the year before, the renewals have first dibs, and then we open it up for new applicants. So if he didn't, I know what you're saying, there were only two, and we've had no new applicants. Okay, they have a couple more days. They have until close of business on Thursday, and then theirs would come to you at the next meeting.
After the license has been granted, then they do the insurance.
So he's just a renewal that's interested in staying a renewal. If he doesn't complete his process, that spot's open on a first come, first serve.
Thanks.
Chris, are there pieces of information missing beside the insurance certificate? Or any of the things, because under section D of the ordinance, the council chair has just pointed out to me, it says the town clerk, license shall not be issued until the licensee has submitted to the town clerk, one, a copy of the required certificate of insurance, and then it goes on to mention parking spaces, victualler license, food service license, and applicable fees. So is there anything beside those 5 items that he's missing?
So both applicants are still waiting for their background checks. And then Dale is just not gonna purchase insurance until after the lottery.
So the background checks are on us that they haven't come back yet.
Yeah, and those, like I said, those are the kind of things where once the council says, yeah, we would approve these renewals, then I would hold the license until everything was complete.
Just to clarify what Peter said, that same section says, after the commercial licenses have been granted by us, the municipal officers, then the town clerk may issue them after the other things are granted, like insurance, or in place, like insurance and all that. So this is the right order. We grant the commercial license, and then she gets the insurance and parking and victualers, and then she gives them the piece of paper. Chip?
Yeah, but this is because he doesn't know he's gonna get the same spot?
Correct.
Because it's a lottery, right? So he wants a specific spot, and because it's a lottery, he may not get that spot. And if he doesn't want the spot that he gets, then he's
just
not gonna do
complete.
insurance and all that. So
Correct.
that's why it's coming this way.
And the two spots, the desirable spots are the two behind Starbucks. There's only 2 applicants, so we're fairly sure that he's gonna get it and he's gonna complete
But
the
he's just
process.
making
Unless
sure,
somebody comes squealing in here before 5 o'clock on Thursday. So.
Got it. Thank you, Chris. Any other questions, comments? Jake?
Only, do we need something for them to be able to?
No, I think they were just
Oh, they're
checking.
waiting for-
There's some additional information that Chris needs to fill in at the
Wanted to
bottom.
make
of
sure
it.
we weren't holding them up.
Yeah, thanks, Jake. All right, all in favor of granting the peddler renewals?
Aye.
Any opposed? That passes unanimously as well. We're on to item number 25-22, which appropriately is up for Counselor Egan to read.
Be it ordered that the Social and Racial Equity Ad Hoc Committee's sunset date be extended from October 20th, 2021 forward to October 20th, 2022.
Second.
Do you want to give us any background on that?
Sure. So this committee was formed by council action in December of 2020, or comprised in December of 2020, and initially had a one-year lifespan on it. The committee started out, maybe not the wisest move, with 16 members, several of which left the group for various reasons, mostly just because they couldn't find the time. Over the course of 2021, a small but active group finished the primary task, which the committee had identified, which was a review of the HR policy as presented to the committee from Assistant Town Manager Judy Hawley. A list of recommendations and some updates, mostly on syntax and inclusive language, was included in that recommendation, as well as a change in the table of contents, and just to sort of make it a little more readable. Those comments were submitted in November. The committee has an interest in continuing because there are more policies and documents to review that they only had that one as a chance to review, as well as wanting to move forward with additional education and communication issues, which was not specifically outlined in the organizational purpose of the committee, but has been clarified by the committee itself. So I'd like for that committee to continue meeting as the liaison to that committee. I have an interest in seeing it continue, and so we're asking for that action this evening.
Hasn't it already sunsetted? So how do we do? Because it was 2021. It is now 2022.
Right. We're asking for a retro decision to move the sunset to October 2022.
Okay. Well, wasn't this part of the police advisory board? Didn't the police advisory board come from this?
No, it was actually just kind of the other way around, that the original Racial Equity Committee was organized from the public and brought to us by the public, by people who are interested in addressing these issues with the police department. That group formed its own citizens advisory committee to the police department, and that's functioning on its own.
I know that came from this committee, right?
Yeah, I thought you said this committee came from the police
No,
advisory. Yeah,
we set this up, and then they just said, hey, we came back, we need to do more, and we set up the police.
that's right.
Advisory committee.
That's right.
So, okay, so I thought it was morphed into that. And you're saying it's not.
No, I think this committee is specifically interested and has tangible community interest, from what I can gather, because there's 5 or 6 people that continue to come and meet, to focus on the issues that are potentially still existing in town documents, in terms of potentially having out-of-date language, non-inclusive language, and potentially implicit racial bias in some of the assumptions about how the town does its business. I don't know what those are, because I haven't examined all of that yet. The other purpose that the committee would like to continue would like for its existence to continue is to be a communication channel for members of the public to be able to come forward if they have experienced something or if they witnessed something that is related to racial inequity and racial bias. And so that's part of the reason why they want to continue for another year.
So this is not for police action, this is something different.
Correct.
So if someone calls them and says, hey, I've had the problem with the police, they're gonna be advised to go to the police board and...
Right, there's a channel for handling complaints. I don't know what that is exactly, but there is a channel in place for that.
And they went through the documents we already had, and they said that they found some non-inclusive language, or they added language that wasn't there and did some syntax changes on, is that what I heard at the beginning here?
That's right, and it was just the HR policy document that was reviewed by the committee.
Okay. So they didn't really find anything that was blatantly racist? Or I'm just trying to understand.
Yeah, I guess that's potentially if you're reading the comments on whether you think they are or not, there was some conversation about the way things were phrased in terms of how people are described and categorized. And so that's a language, sort of updating a language. Another possibility is, I shouldn't say another possibility, another area that was focused on by the committee was hiring practices, and what extent does the town go to encourage a diversity of candidates for positions.
John, if I could, I think a lot of the things that they found, I wouldn't say was racist language, but they sure found a lot of sexist language, because the entire code of ordinances for the town was generated in the 1970s. I used to play a game with our former police chief, Sue Nurse, about who could first find the police chief or his designee in every single ordinance, because nobody ever dreamt of a day when they were writing these ordinances in the 70s, and Sue was really a good sport about it, but she was serious about it. Why did everything have to be that? And you'll see that almost worse than police chief or his designee is town manager or his designee. Almost every single ordinance, every reference.
It's not police chief, it's his designee that was the
right.
issue.
It's the gender. There's a lot of gender assumptions.
And I get that. We got to clean that up.
Those positions of authority, right? As they come up, we clean them up. But it's helpful to me and to Judy to have a set of eyes looking that over, because there's 30, 40 pages of somebody looking through it and saying, hey, you missed a his or her, and just the transition to there in most cases solves almost all of those problems. But it's just, it's helpful.
Councilor Pillsbury.
So a couple questions. I think the work that the committee is doing is great. Love to see it extended. Is the charge broad enough to continue the work that you're talking about? Does that have to be looked at any point? And then I guess my second question would be, what do we do? I mean, what's the aim long-term for this? Is there something we should be thinking about now? Should it come back to us in the summer? I mean, or are we just going to go year to year with this? What do you see as I see long-term value in it if it's structured the right way. What are the thoughts of the committee on this?
Part of the reason why it's year to year is because when it was first formed, the council at that time made a decision to put it on an annual basis, so that it was not in perpetuity as a standing committee of the council. So there was some laser-focused tasks that the group undertook during that first year. Some challenges with getting participation on that committee from a number of different factors, but there's now, and it'll be coming forward at the next meeting, some additional voices and people coming forward who want to participate in it. Because frankly, there are members of the public who are coming forward that says, we all think as white people in this town that there are no racial issues and there are no glaring issues of inequality in our community, but I can tell you that there are. And so there has to be some kind of channel for that to come forward. So I think that at least having a committee that's meeting to talk about this issue is one way to have those voices be heard. And if there is an issue, then this committee can bring it forward to the council.
And the charge is, you're okay with the charge at the moment, meeting whatever
I
the-
can't recite that off the top of my head, Matt, but I don't feel like that the charge of the original committee is too constricting at this point.
Thank you. Chip?
How diverse is the group?
Well, that is something that we're working on. The group started out, if you want to be blunt about it, the group started out with 16 members, 9 of whom were non-white. The group finished the year with 5 members, 2 of whom were non-white. And so there's an active effort to solicit some more input on the committee from non-white members of our residency, of our community. And those folks are stepping forward.
And since it's social, is it diverse in that way too?
It is.
Any other questions? All right, all in favor of extending the sunset date?
Aye.
Any opposed? Unanimous passage. Thank you.
Thank you.
John,
Thank you.
for the work that you do, and please forward that to the other folks in the committee for the work that they're doing. We have 2 items that have been kind of moving in tandem from one agenda to the next. Item 194-21 and 195-21, both relating to shoreland zoning. The first one is the ordinance, the second one is the map that goes with the ordinance. And I believe we have our town planner here to give us an update on what's going on with these.
Sure. Unfortunately, due to other projects that the planning board had in the queue that have been before you the past couple meetings and some involvement with the visioning, we have not made as much progress on this as we had hoped. So at this point, I think we'd like to request that the council table it for another month to give us some time to work on it. I have been contacted by a few of our residents who will be impacted by the changes that if they were adopted by the council, this would allow them to go forward and do projects. So we do have some people that are watching this and wanting us to move forward. So it's definitely a priority project that we need to get back to working on.
So
Happy to answer any questions.
1 month from today would be February, or the 2 meetings from now would be February 15th, which is just about a month from today. So that's what the request is. That gives you enough time to do what you need to do?
Honestly, with the vision and the downtown design weekend there, it's going to be tight, but I think if we're not ready, we could bump it out another meeting.
Okay.
I think it depends.
Let's put it in March.
Shopping with Councilor Pilch and Bradley to go through and see if there's things we wanted to approach DEP on, you know, if we had any leeway or some reconsideration ability on certain standards. So I think some of that timing will depend on, you know, those discussions.
Caroline, would you remind me, I have a recollection that at our last committee meeting, we talked about breaking out shoreland zoning from the ordinance and dealing with it as a separate standalone ordinance, and that you were going to have the consultant tell you or work with you on that, and then we were going to get back together and bring it to the council. Am I wrong?
No, you are correct. So we took the initial steps of trying to pull it out, but part of that is not only pulling it out and looking at what we can do or which ones we can look at, but also we have to clean up what's remaining in the current zoning ordinance and check all cross references. So it is a pretty involved project, but yes, you are correct. We're looking at a standalone shoreland zoning ordinance.
And that's what we're thinking about bringing potentially to the council either in February or March.
Yes, we'll get it drafted up, and I think the next step would be to then meet with you and Councilor Pilch to go through it and see what we want our next steps to be, and whether or not it needs to go to DEP for input and then back to planning board or to the council.
Thank you.
Yeah. Given all the work that's still ahead of us, I'd suggest moving it out at least one more meeting to March 1st, which hopefully still gives the applicants time to do things before the summer, but gives us a little bit more time to do what I think you need to do, and then have a meeting with us, and then bring it to council. So unless you object, I'd propose March 1st. Any other questions?
We need a motion to table.
We do need a
March
motion
1st.
to table, yeah.
So moved.
Thank you, Chip.
Second.
Thank you, Jake. Any other questions? All right, all in favor of tabling till March 1st, both items number 194-21 and 195-21?
Aye.
Any opposed? All right, that passes 7-0. Thank you, Caroline, and thank you, counselors. That is the end of the action part of our agenda. We have one item of other business before everyone gets to go home, which is an update on our water tanks.
All right, well, I'll rip through, I've got a document that I handed out here, questions and answers. It's a lot of the questions that have come up in the, everything that I had notes on, some from a couple residents and some from counselors. I can go through, there's some supporting information that I don't need to go through, you can go through on your own if you'd like. The original construction cost to the tanks, to the taxpayer, Bow Street tank was $225,000. That was 1972 to 74 approximately. Oh, the good old days. The Winston Hill tank was at no cost. It was primarily grant funded. There were local matches that were provided by the sewer district, line extension, and by the donation of the land to the town by the water company at the time. So, the town is all in $225,000 essentially. What were we paid back from Consumers Water and Maine Water Company as the successor? The town was paid of that $225,000, $43,000. If you look on that spreadsheet, that was until approximately 2000. At which point in 2000, the town had begun to generate lease revenue from the exterior of those tanks, and the town actually forgave the debt to Maine Water at the time and says, you know what, we're making so much money off this now, we don't need the money from you and the ratepayers. Again, not a decision any of us made, but a decision that the town made in 2000, 21 years ago roughly. We got a question about industry norm for rent from a tank. This is a really tough one because that's not a very common thing to have happen. Utilities usually own their tanks, so reasons why you might have a tank owned by somebody and operated by another party are pretty much limited to scenarios like this, and they're all really weird. So like, for example, this Freeport scenario that we have where we own the tanks and they operate them at no cost to us is a strange arrangement. So I wouldn't want to say there's an industry norm because this shouldn't really happen this way in the industry, which is why they want to have us get rid of the tanks and give them to them so it does become the industry norm. All right. Revenue received by the town for ownership of the tanks. We don't have good records prior to 2006, or 2009. We do have perfect electronic, because we switched financial systems then, records after 2009. We generated $3,148,540 in revenue since 2009. The estimate moving backwards was, looking at the old records, was about $150,000 a year before that. We don't know when we could go back and we'd have to go through the leases to find out when the first lease was signed. It was, right around this turn of the millennium though. So, the number I can tell you is much more than 3 million, probably closer to $4 million is what the town has generated off those tanks. None of that would have been generated if the water ratepayers originally financed the tanks. That would have all gone to support the ratepayers, the water ratepayers, instead of the general fund. So if you see the theme I'm building up to here, we spent $225,000 and we've made millions off the tanks. So that's kind of where I'm going here. Where was it stated that we got a question on the intent of the town to turn over the tanks to the water company? This is a really interesting question for local government geeks like me to research. The 1972 agreement between I'm surprised Tom hasn't come through the door and yelled at me to turn my mic on. I've been talking without my mic on the whole time. I guess Dan must have picked me up, so thanks. 1972 agreement between the Board of Selectmen, your predecessors, before there was a town council, before the charter was passed. The selectmen were authorized by town meeting at the time to negotiate with Maine Water. So they made this agreement, and item number 10 on this agreement said,
It is the intent of both the Water Study Committee and the company, although the town is not formally authorized to contract in this respect, that the ownership of the standpipe should be transferred for nominal consideration from the town to the company at the termination of the lease. Standpipe is a technical definition of a tank that doesn't have legs on it, that is just a pipe that goes up into the air. So what they meant by that, they don't have authorization, is because they were not a legislative body at the time. They were an executive body, is the selectmen. So town meeting would have had to authorize that, but it was the intent of the selectmen to bring something back to them, which they did, which was brought to the town council at the termination of these leases. However, for two reasons, they were not renewed. One is that the town decided to build a second tank and utilize a similar type of agreement where the town owned it to utilize federal grant money, which was how Winston Hill was constructed in the 90s. So that's why they didn't do it in the 90s, transfer them back. And then in the 2000s, the town had started to get the telecom revenue. And as I mentioned before, your former town manager did a really good job of looking out for the town's finances and basically said, we're not going to go down that route. Let's renew this for another 20 years, because the town at the time did not want to give up the leasing revenue. How has that changed? Well, water company said, well, we don't want the leasing revenue. You take the exterior of the tank, the outside, lease it in perpetuity as long as these tanks stand to your heart's content. Get that, hundreds of thousands of dollars a year. We're not looking for that. We just want the ownership of the the facility. So I just checked off two items there. So again, I think the town made the right decision not to transfer it if you couldn't get the leasing rights to it. Maine Water Company has since changed their tune, and they're fine transferring it without the leasing rights if that stands in the way. So that's why things are different and why I'm here talking to you this time. The expected lifespan of the assets, both of them are over 80 years. The Bow Street tank is 80 years. I believe we were told the expected life on the other tank was 100 years because it's a different type of construction. I could be wrong on that. It's at least 80 years on both of those tanks. So that translates to at least one more painting cycle when we had this discussion last time. That the painting happens every 20 years. So you got 20 more years and then another 20 years after that for Bow Street.
Just so you know, I don't think we have that page in our packet. But keep going.
Oh, this
And
didn't
we'll post it,
this didn't double side to you?
Yeah, I think there's a page or two missing, but.
Oh, I'm sorry.
I
Okay.
assume that you'll put it all up on the website after tonight.
I
so
will be
people
glad
can
to do
follow
that
you.
now, yes. Value of the assets, the town currently appraises them at $400,000 for Winston Hill and $665,000 roughly for Bow Street. And that is the taxable value. That is the value that we would levy a tax on if they were transferred to the private owner. So it would be like picking up two new single-family homes essentially to tax. They're currently non-taxable because they're a municipal facility. That depreciates, the PUC has a depreciation schedule, so that's out of our hands at what rate that happens, but that's what we say they're worth right now. So, how many customers are served by Maine Water Company? They told us there are 945 active accounts right now. So more customers are served but do not have hookups. For example, vacant parcels that aren't built on yet. But there are 945 properties that have a service line that get an account. There's also roughly 100 plus a little bit more fire services that are non-metered, so they pay a rate yearly for that. But that's for, like, example, this building has a sprinkler system. A lot of the buildings in town, the schools, bigger places of assembly. So 945 properties, 100 of those also get fire protection services. I'm almost done. What would happen if this is a good question. What would happen if the town performed a public takeover of the water company assets, which I think has been in the back of my mind ever since this process started? So I had a good conversation with Rick at Maine Water. The way that, and he's very familiar with it because he deals with this on a regular basis, the way that those values are calculated, it's from the ratepayer's perspective, and the value is automatically zero if it's an asset that is given or gifted or transferred into the system. So this is by the PUC rules, so there's no variance allowable here. Because I originally went to him and said, would Maine Water agree to, call it zero damages if we ever had to do a public sector takeover? And he said, no, there's no need because the PUC defines it. If it's given to us, PUC defines it as zero. If you have to take it from us in the future, it would automatically be zero. So if they don't put out ratepayer money on the purchase of the asset, then it's worth zero in a public takeover. That's for any of their facilities.
there would be a great value placed on all the, you know, the pipes and all the pumps and all the appurtenances, everything else in the system. There would be a great cost to the town, but not the tanks, yeah. Okay. With the cost of water increase, the cost to the rate, for that same reason, the cost of the ratepayer would only increase if there was a cost to them to purchase it from the town. There has been talk about that. Is that the right thing to do? Why transfer these tanks? Why now? So from the town's perspective, Maine Water Company has agreed to allow the leasing, continue to allow the leasing, which is the biggest single financial consideration in this whole thing, which wasn't on the table 20 years ago. The existing agreement is expired as of December 31st, so if we're not going ahead with this, I need to at least renew an agreement either for 1 year or 20 years or whatever we want to do. Maine Water will continue to pay all maintenance costs because they're going to operate the facility, so there's no cost to the town. Maine Water is responsible for the future replacement of the tanks, which is important because that's not guaranteed. It's likely to be the negotiated outcome if something, for example, were to happen and the tank were to fail catastrophically, or a replacement needed to be made in 40 years, but it's not guaranteed if we're holding the tank. It would have to be negotiated between the parties. It could be messy. It could be really messy. Not like I'm gonna have to really worry about it 40 years from now, not like anybody here is gonna have to worry about it 40 years from now, but it's not a position that I'd like to leave the town in 40 years from now, so. And then the last bit, there would be some tax revenue from it that we're not collecting now. Not a lot, not enough to make the decision on, but it's an added bonus. The question was asked, who owns Freeport Water? Freeport Water was the original company. It's always been a privately held company. It was owned by Consumers Water of Maine at the time that all these agreements were put in place in 1972. It's since been acquired by Maine Water Company, who serves additionally 11 other communities beside Freeport in Maine. I think I've seen like 30,000 customers was the number, which pales in comparison to their holding company, which is SJW Group, that stands for San Jose Water. San Jose Water is a major utility, but so the utilities that are owned by SJW Group are San Jose Water, the actual million-person utility, million-customer utility, Connecticut Water in Connecticut, and SJWTX, which is in Texas. It's San Jose Water. It's a sub-district in Texas that they run as well. So there's 4 public utilities that are owned by this public utility company. U.S. company, but it's a conglomerate of water company, which is good because they specialize in water utilities. So it's better than being owned by like an oil company or, you know, something like that, where you might not, or fracking company or something like that. So they do specialize in it, but people may have views that it's, you know, it's bad to be held by a big company. They've never been a public company. They've always been a privately held company since, I should say they're public from a stock exchange perspective now, but they've never been a governmental company. They've always been a private corporation since they started here. Structural evaluation performed on the tanks. They look at them yearly, twice yearly, three times yearly. I don't have access to those reports. If that's a major thing, I'm sure we could get them. There's no reason that they're hiding those, but I'd have to call up one of their engineers and request them. They do evaluate them. If we become, in the off chance we become aware of a problem before they do, we call them and they're there immediately. They have an operator who's here, as they have for years, an engineer who's responsible for Freeport. I'm thinking, you know, in the past 5 years, somebody apparently shot it through one of the tanks with a 30 caliber rifle, right in your neighborhood, Dan.
Right in my neighborhood.
Did you hear that by any
I heard
chance?
about my neighbor complaining that her driveway was all ice.
Yeah, there was a
because there's
little
a
weeping
waterfall
hole coming out of it. So, so we get made aware of it. We call them. They repair the tank. That's kind of how it works. So we don't regularly check it. Dan's neighbors essentially call us if there's a problem. Most of the things that Maine Water would pick up on any major issue, because they're all SCADA-controlled systems, which is internet-controlled. They see that, hey, the pressure's dropping over here, the water tank's not full enough. They send someone up to look at it, and they find the problem. So they're remotely monitored all over the place. Councilor Fournier. Yes.
And you may not know it, South Freeport, did they take over that system, you know?
They operate under contract to South Freeport. So South Freeport Water
Who
District.
owns it?
South Freeport Water District is a public quasi-governmental utility like Freeport Sewer District.
Okay.
So, but they contract with Maine Water for the operation and the billing of that.
Are they trying to take that system over? You don't know?
No, they wouldn't take it over.
But
it wouldn't usually work that way unless for some reason the public entity wanted to sell it. I guess maybe it could
Okay.
happen, but, no, they're happy with the contracted service that they have there, so.
And I think you fixed this. My second question, as far as the operator, we used to have an operator that lived in town that would respond out on second alarm fires to open valves to get more water flow. Where are we at on that?
They do not have somebody who lives in town.
Okay.
So they've got, there's an engineer who runs a couple, three maybe districts. They're all about an hour apart. He's over in southern Oxford County and here. A lot of the system is computer controlled, but not, not everything. There are
Okay, well,
some.
maybe that's solved then. Okay, great, thank you, thank you.
What happens at the end of the useful life of these towers? They replace it, do we still get the revenue from the tower, or are we still on the outside of the tower after they replace it, or is that?
That's not really contemplated. One thing I can think of is that on one of the parcels, we're retaining the land, so that would be an easy negotiation. The other one on Bow Street, there's no guarantee that 40, 50 years from now that they would need, it's for the tank as it exists, just like there's no guarantee. I mean, I guess the only way around that is if we owned it and we committed to rebuilding it in 40 or 50 years. So that's what we're giving up, potentially.
Couldn't we
40 or
just,
50 years,
couldn't we just include that in the, we'll give this to you, but if any other existing tanks get built in Freeport by you, we want to be able to utilize
Yep.
Well, that
the
wasn't,
exterior?
yeah, that was. that
It's
was a
replacement or on that site possibly would probably be the easiest way, yeah.
I was just talking about the current ones, once they,
Yep.
they gotta tear them down, all the antennas and everything coming off, do we still?
Yeah, I don't think
get
we're
the
looking to
revenues for that
grow,
one?
I don't think we're looking to grow necessarily,
no,
but maintain would be good. We can talk about that for sure.
I think Jake just hit a good point, though. If we do grow, and we never thought we'd have a Winston Hill, but that come up. You know, there has been talk years ago of expanding up to North Freeport, Route 1 North. So, could we put something in there that would allow us to use a new tank for cellular communications so we could continue a revenue stream like we have with the current two? I wonder if they'd be open to that.
Probably come down to if we help build the tank like we did with these two. I mean, that's.
Who knows?
Yeah, well, I mean, it's money, so I don't know if they'd necessarily be like, yeah, all future money, you can have all of our future money.
Yeah.
What would be their economic incentive to pay for their whole brand-new tank and then give us the cell revenue?
Right, they wouldn't.
I don't know, but, you know, it's funny how the board made an agreement back in the 70s, and economic for them does, for us it would make great sense, but probably for them, no. I don't know whether, you know, we were very fortunate to do what we have done with the cellular, so.
I wouldn't-
You're probably exactly right, for a private company, it would make no incentive for them, but.
I don't think I'd sign that deal if I was in their
Yeah.
shoes.
I don't know, they're a public water company, what are they, you know, are they doing cell phone stuff on all their other ones, or is this not?
Oh, yeah,
Oh, okay.
every tower, every.
Yeah. It's kind of how the calculus is done when you build a new tower about how much you can offset through other uses and stuff like that. So, like if we were to build, for example, a $5 million water tank, let's say that we were the utility, we'd want to say, hey, we could get $100,000 a year or $300,000 a year in revenue. Okay, over 40 years, pay for itself in revenue. You know, you take that off the top when you do a bond. So,
But how bad do they want these water towers?
Well,
I don't think bad enough to give up all the future revenue everywhere. I mean,
But at those two locations, maybe?
it's possible.
And that's just because of the way, that's because it was financed by the town.
Yep.
So the town owned them, we built it, we didn't transfer it over, we paid for it with a grant. It was, actually, it was probably a pretty good partnership, the way it all worked out. But if they wanted to build a new tower, and it was all on them, we don't have any dog in that fight other than say, go ahead and build a
Well,
tower.
we also wouldn't be the ones building the tower because they would be.
Right, that's what I mean.
Right.
If we were
Unless they
building
came
the
to us
tower.
and said, will you help us do this for some reason that's unclear. Also, should be noted, financing was a lot different back then. They were looking at 15% bond rates or loan rates for private business as opposed to a 7% bond that the town was able to get. Now we're able to get 2, 3, so, you know, and they're able to get 5% loans. So it's a much different market. That could change. Councilor Bradley.
Yeah, This is all very interesting, and I don't pretend to understand all the ins and outs of it, but they are asking us to transfer the water tower ownership to them, and started with us for a whole variety of reasons that you've explained. And the question keeps coming back to me is, why are we giving them something for nothing? And, we already have the revenue stream from the outside, right? We know that they're gonna continue to use this for their ratepayers and make the money they want, even if we keep it. So, and we paid for it in the beginning, so I'm thinking that a taxpayer is gonna ask me, why did you vote to give the water tower, which has some value, which you've given to it, to them for no return to the taxpayer? And I don't know the answer to that question, and none of this other about what we might negotiate in the future helps me get there.
So the whole reason we owned them in the first place was to save money for the ratepayers. The whole reason we took on that ownership, took on the loan for one and the grant financing for the other one, was to save money for the ratepayers. We ask for that money from the ratepayers. That's coming straight from the ratepayers. That's how it's calculated. They talk with us when they talk with us. Sure, if that's on the table, we could do that. It's going to come from the ratepayers. So
My first question is, isn't there some value that they're asking us to give them?
yes,
And we are considering giving it to them for nothing other than to continue a right which we already have.
no, we're giving it so we don't have to build the $5 million water tank or a $10 million or a $30 million water tank in 2050 numbers when it comes up for replacement.
Well,
We do not want to be under. That's the biggest, beside bridges, that's the second biggest piece of infrastructure that a municipality
Why
owns.
is I don't know, why is the refusal or the decision not to convey title to these water tanks preclude them or us from building the tank and whenever its replacement is required? In other words, what does,
I guess I'm not seeing the question.
well, why does our decision not to convey ownership of these water tanks mean that we're going to have to build the replacement when replacement comes up?
It's not guaranteed.
It's not, no, it's an open question.
It's certainly guaranteed if we're not holding the tank, we're not in the discussion.
Well, fair enough, but there's no requirement, if we give them the ownership of these tanks, that they're going to replace them in 50 years.
Well, I think it's also the ongoing maintenance and liability, right? Like, we'd have to pay to paint it and repair it.
That's not in the deal.
It is in the deal. So the reason we don't pay for it now is because in the agreement that expired in December, it says they'll do all annual maintenance. They may continue to do that, or they may want to have a different conversation about that if we go forward.
We don't know.
No.
Okay, so I guess again, I'm just trying to figure out how you explain to somebody, you gave somebody something and you didn't get anything for it. I'm still not hearing it, but I'm open to hear it.
Well, if what he's saying is if they purchased them, if they purchased the tanks, the ratepayers would be paying that price.
What, the
Our
replacement?
taxpayers. The replacement and whatever we charge them, if we charge them $1 million, there's 900 customers? That's gonna show up in their water bill.
Correct.
And that's our taxpayers.
It's one Freeport pocket into another Freeport pocket.
Yeah, but frankly, I don't represent the Freeport ratepayers.
Yes, you do.
Well, you say you do.
You don't,
You
but
may.
District 3.
There may be an
I don't
overlap.
have mine either, yeah,
So,
Yeah, got it.
Again, I'm looking at it sort of narrowly, I accept that, but before I walk away from it, I'd like to hear the answer to why the narrow view is wrong. John?
Do we have any, since the contract expired, do we have any ironclad assurance that we get to continue to keep the cell tower revenue if we charge them a fee?
That's the only thing that we get ironclad assurance over because we own it. Everything, the maintenance costs ongoing and the replacement costs are not ironclad, they're negotiable. The only thing that we can dictate is that we own the exterior of those tanks just like we own the inside of them right now.
Right.
The question is,
Do we want to continue owning the inside?
So we get to keep, what's the annual revenue in the cell tower, 150 a year?
no, closer to 300 right now.
Okay, so we get to keep 300 a year in revenue
With zero.
and the maintenance and liability of replacement tank, or we get to keep the 300 in revenue and get rid of the liability and the replacement cost?
I don't know that we have you say we get rid of the replacement costs. I mean, we wouldn't do it, we're not gonna do it anyway. But that doesn't mean they've gotta do it. Just because we gave them the ownership of these tanks doesn't mean that they're gonna replace them when these tanks wear out.
Sure, because you can't run a utility that generates profit without the tank.
And they're gonna do it anyway. I mean, that's the answer to John's question. If they need a utility in Freeport, at the end of 50 years, we may have another negotiation.
Maybe.
They have to pay for the replacement, they may wanna own them, I can get that. That still doesn't answer my question, is why we give it to them now for no money.
The maintenance is not insignificant, right? The maintenance over the next 30, 40 years of the tank
You're
is
talking hundreds of thousands a year.
hundreds of thousands a year for a $400,000 water tank. So,
For two tanks together, probably.
So it seems like if we don't give it to them, they may ask us to say, hey, you have to maintain these tanks.
The painting amortized over 20 years is $30,000 a
And
year.
if we don't do it, what happens? We close the water tanks and shut down the water district? I don't think
And we
so.
all get recalled.
Well, we could.
Right, 900 people all of a sudden don't have water tomorrow.
I mean, it doesn't have any real consequence for any of us except for Dan, let's be honest.
Exactly, yeah, they're all in my district, yeah.
But I mean, it becomes a much more drastic cost on the ratepayers. I guess my question is, what's the benefit to keeping them? The benefit to asking for, I understand the question of asking for money. If there's a negotiated price for some reason that we, for some reason, want the ratepayers to pay the taxpayers, I don't understand why that is, because the whole reason we got into this mess in the first place was to save money for the ratepayers. But if we want to milk the ratepayers now for this instead.
I'm not milking anybody, I'm just looking for, is there a fair value for these assets that we're transferring, which only the ratepayers use, none of the people in my district or many other districts use. And so is it fair to ask them to pay the whole town the value of what only they use? I think there's at least a reasonable question there. I don't know what the answer to it is, but I would like to know what the value would be and make some sense of that. And then we can talk through the other issues. And if nobody else wants to do this but me, I'm happy to adjourn. If I'm the only one moving this way.
Darryl, what do you got?
I'll answer one thing for your district, which I live in your district, Ed, so.
You're welcome.
So I do receive a benefit from the ratepayers, because the hydrant down on Bow Street is within a 5-mile radius of my home, and I received a lower fire insurance premium. So in the retrospect of the people in the outlying areas that have no fire hydrants there, through the fire protection that we pay through ICE, the Insurance Services Office, there is a benefit. So we all benefit from that. However,
You, the 5-mile people do, but those.
oh yeah, then that's another discussion for you. Yeah, you're right there, Ed. So my other question, Peter, I have though, so if we give them the tanks and we expand the system and we have to go up higher on Winston Hill, can we add more cell service to Winston Hill if that tank goes higher? Is that part of the agreement we're gonna have? I wanna get back to Jake's point. I think if we're gonna give these tanks, and maybe they come in with a new standpipe 40 years from now, and maybe the standpipe's bigger than here. I wanna have the access for communications.
Yep.
And perpetuity.
That's a good point, and I think that could be negotiated, or I'll tell you that I failed. I think I can have that conversation.
Yeah,
So
Yes.
in 50 years, we may be doing something else, they may not have any antennas on there.
Probably.
Right, because we're gonna have quantum communications with satellites that don't need antennas. But assuming that the technology stays where it is, it's likely that radio of some sort will be required, so I think it's a good assumption that we would at least want it. For the same reason we'd want to retain the land if it's the highest land in town, even if water tanks aren't a thing in the future, towers might be, or antennas might still be, and we might need to use that, so.
So, Ed, is there a benefit to the people in your district for not having our vibrant downtown burned down for lack of water?
Oh my God, I don't know.
I would think that's a benefit to everybody in town, that we've got hydrants up and down Main Street to protect our commercial core.
I was talking about the value of the asset, we can all talk about the interrelationship of all of the things we deal with to everyone, and I'd be glad to have that conversation over beer with you anywhere.
So, I guess the closest I can come, and it's not probably close enough, Ed, you probably won't think so, but the closest I can come to this is just looking at the financials. We built a $225, it's a $150,000 asset with $75,000 in finance fees. So we saved the ratepayers $75,000 at the time in extra finance fees, because they would have paid double on the market. That's what this whole thing was about.
Right.
So, and then they paid us back
It was 43,000.
43,000. So, the 160 to 180, depending whether you want to include the finance fees or not, that's really what the taxpayers expended. You can extrapolate that out to today's dollars if you want, but that's what we're talking about, that we expended on behalf of the ratepayers. Because we did that, we're making millions of dollars extra that we never would have made before.
Right.
So in my opinion,
We made out.
we just hit red on a 14 color roulette table, right? Like that shouldn't have happened. We got lucky.
And it worked.
If we want to go after the ratepayers for what we feel the taxpayers are owed, we can do that, but that's going to be
Messy.
everybody. I mean, no, it's a legitimate policy point if we want to charge ratepayers for that $180,000 difference. But to me, it seems like we ended up 2.9 million, at least, probably more like 3.9 million when you take into account those first 10 years, close to $4 million, right, in the positive, where we wouldn't have been.
Right.
Do we want to calculate the exact number we want for reimbursement from the ratepayers? We can,
But the
but
whole
it's
town
gonna,
is
but
benefiting from that.
but everybody is gonna have to, we're gonna have to understand that it means ratepayers' rates will go up, and we'll have to be able to justify that. Dan will have to be able to vote no, so he doesn't get run out of office, but we'll have to be able to justify that. I mean, and they're in every district. It's not just District 1, but probably 500 or 600 of those are in District 1. So, it's not wrong to ask for the money back. However, it is, I just am questioning if it's really relevant in the scale of $4 million to talk about whatever that $180,000 would be in today's dollars. Seems like a nice gift for the ratepayers. Somebody at the time wanted to do a gift, wanted to do a handout. Somebody in 2000 also agreed that Maine Water could stop paying us rent on it because we were doing so well off of the returns.
It strikes me, and I don't mean this as a personal comment at all, but it strikes me as greedy to ask for more when we've gotten so much out of it already.
And we'll continue to get it.
Yeah. So as a town, it strikes me that it's a fair thing to do to give them the tank.
And there's one other.
Could I hear two more people say that?
Oh.
Two, 1, 2, 3, one more.
I'll be
One
on.
more.
I'll be
I got
on,
you,
Peter.
I got you.
I'll be on, Peter, if you
That's
get
absolutely
agreement
There,
if
it's
the
4.
towers go up.
I give up. Jesus, twist his arm.
All right, that's all I want to see.
All right, I'll bring back that with the documents with the proposed transfer agreement at the next meeting between our two attorneys that they have worked on. I'll bring that back with an answer of yes, I got it or I didn't, understanding that Daryl might not vote for it if I don't get that, and maybe Jake might not either, because Jake seemed like he wanted that too, so.
Then there's one other aspect.
Sounds to me like to get this deal done, that might be something that they'd want to throw in.
And it's also holding up, putting another set of antennas on the tower. I'm not exactly sure why. I think we could still do that, even in the transfer, but to get the problem fixed downtown,
Right.
or we need to get this going so that we can get the antennas on there by the summertime.
Right.
We need to do that now, not April.
Yep, absolutely. Yes. And anybody else who's still watching, please don't shoot holes in the water tank from my house, because you might miss and hit me. All right. You have what you need to move forward on this, I
I'm
think?
bringing you something for consideration at the next meeting. I think there's still a question about
The details, which we can
details.
deal with at the next meeting. Okay.
It's 10 o'clock, so I'll shut up.
Any other, yes, Counselor Egan?
I move we adjourn.
That's my line.
Second. All in favor? Aye. Thank you. We are adjourned at 10:52.
No, 9:52.
Oh, 9:52. Thank you. Thank you.
Give me that hour back.